welcome everyone. My name is Bianca. I am working with the MenEngage Alliance Global Secretariat. And just welcome to all the speakers, and thank you to Parental for organizing today's session, launching the State of the World's Father 2021 report. Please do feel free to follow us on hashtag Ubuntu Symposium or Spanish, the hashtag Symposio Ubuntu. And with that, I'm just going to hand us over to Gary, who will get us started with the session. So thanks, everyone.
Thanks, Bianca, and welcome everyone to the launch of the 2021 State of the World's Fathers report. I want to start off by thanking Bianca and all the MenEngage team. You've done a tireless, fabulous job of this year-long online symposium, which has been no easy feat of keeping dynamic content, keeping us focused on the cause, and thanks for hosting us as well and offering us this opportunity to launch the report. I want to bring up the slides if you could. We're proud to put these images into the world of the report. We focus this year's State of the World's Fathers report on care during COVID-19 because we must. COVID-19 has been a crisis of care. It's laid bare the inequalities in care systems, in health systems, in economic systems. As we all know from the research, from paying attention to what's happening in our communities, it's exacerbated race-based and region-based and gender-based inequalities. We know that women have been 1.8 times more likely to be out of work during COVID than men have. And we know that COVID has shamefully laid bare the politics of indifference that we faced in the US in the previous administration, that we still face in Brazil and India and many other countries that have faced the hardest and highest numbers of deaths from COVID. I think we've all grown tired and fatigued and anguished about the death toll, but I do think it is worth mentioning that there have been 3.8 million COVID-related deaths that we know of to date. I say this as well because my family has suffered two of those. We lost a dear aunt in Brazil and one in the US, both victims of the neglect of care systems, of elder care systems, of healthcare systems, of politics that have failed to put care front and center. We dedicate this State of the World's Fathers 2021 to the millions of families who have lost so much during COVID, loved ones and so much else. I also want to, and you'll see in the report that goes online as we speak today, and now that we dedicate it to our dear colleague Nikolai Ehrman from Russia, who passed more than a year ago. He was tireless in his work to promote gender transformative parenting and engagement of fathers, and was a leader with so many other brave colleagues in Russia of the MenCare initiative there. And we wanted to remember Nikolai in this moment. I also want to, although I have the privilege of presenting some of these headlines and where we think the report can land and support structural solutions to achieve care equality, I want to thank my co-authors of the report. This wouldn't be possible without them. Apta Garg, who you'll hear from, Brian Heilman, Nikki Vandegog, Rachel Mahaffey, and all the colleagues at Promundo and Sanke Gender Justice who made this possible. Thanks as well to the MenEngage Steering Committee, which is, in addition to Sanke and Promundo, includes Save the Children, Oxfam, Plan International, and of course the MenEngage Secretariat. I want to thank as well our funding partners, the UN Foundation, the Oak Foundation, and thank our colleagues at P&G who are also supporting in the dissemination of the report. We'll go to the first slide, please, the next slide. We are inspired by the definition of care that the colleagues from the Care Manifesto in the UK promote. They put together a call for the politics of interdependence and to think about care as centered in our lives as what supports us and drives us. And I think it's worth reading their definition of care as our individual and common ability to provide the political, social, material, and emotional conditions that allow the vast majority of people and living creatures on this planet to thrive along with the planet itself. And I think that definition takes us to the politics of care as well as to the humanity of care. And it certainly has centered, as we worked on this year's report, to think of care equality in the home as something that we focus on in the report and the conditions necessary to do that, but also is tied to the global politics of how we care for ourselves as individuals, ourselves as humans, the planet that we live in, and the creation of just economies. We don't see care equality in the home as a standalone. We don't see fatherhood as just the biological connection of men to children, although that's important as well, but really as this complex web of how humans interact and make the world habitable and supportable for all of us. That's the framing that we take into this report. The next slide, please. We start by centering the global inequality in terms of who does care and why that's important. We know from looking at this data since we started the State of the World's Fathers report in 2015 that women do more than 3 times of the daily care in our homes. We know that that starts in childhood, that girls are 3.5 times more likely to spend time on care work in their homes compared to boys. We know this is not just a matter of minutes on a clock. This is time and opportunity. This cuts women off from the opportunities they need and want and deserve in the world, that girls need and want and deserve in the world. And we know from looking at this data since 2015, and I wish we could say that we had some success stories, that 0 countries in the world have achieved equality and unpaid care work between men and women. With all that we've done in this unfinished revolution for gender equality, no country has achieved equality in pay and in women's employment, in women's political participation, and related to that, no country has achieved equality in care work. That we've been able to find for all the important policy work on care work, no country has put in writing that they believe and have a date and a policy goal of achieving full equality of men's participation in unpaid care work. Next slide, please. We know that care equality matters for individuals, for families, for communities. From our reviews of the data and lots of other data, it matters for child development. It matters for whether our sons grow up believing in equality in the home and whether our daughters grow up aspiring and believing they have the full right to everything that the world offers. We know that where men participate more in the care of children, there's lower violence, both at home and at a societal level. We know that men who report better, more involved relationships with those they care for are happier and healthier, that women are happier and healthier when men in the context of heterosexual households participate more and more equitably in household care. When men support it at the community level and at the political level, we know that it increases women's leadership and participation in paid work. And we know that it contributes, as I said before, to the fulfillment of children's rights and children's ability to grow and thrive as they should. We don't see care equality in the home as a standalone, but as connected to the full gender justice agenda that we need for women's equality and reproductive health and rights, to a life free from violence, to economic justice. And we also see it as linked to care of the climate. As we cite in the report, research has shown consistently across countries that men on aggregate are less likely than women to say that they would change, that we would change our lifestyles, that we would take the hard economic decisions to protect our planet. And yet we know from UN data and others that women and girls are more likely to face the cost of climate change. Care equality matters because it's tied to how we promote healthy and equitable versions of manhood. The next, please. From the data that we have, and I think it's important to say the amount of data we have on time use and care work is far less than some other sectors that we measure consistently. Time use studies from ILO that we've been monitoring and using, and thank those the researchers at ILO who have gathered this data regularly from a number of countries. And men are doing slightly higher amounts of care work, but the rate of change is so slow that based on the data we have to achieve full equality in care work at home, the track that we're on at the moment is 92 years before we achieve equality. That masks huge regional diversities, and in fact, most of that data is from middle income countries For lower income countries, we know there's some that at the current rate of change, that number's even higher. But we think that is a sobering number to look at where we are and where we need to be to achieve full care equality. We know that in some parts of the world, Europe, parts of North America, about 30% of women tell us that they have achieved some form of equality in their homes in terms of the care work. In other countries, it's 10 or 15% of households that tell us, listening to women's voices on that, that tell us there is something close to equality in terms of care work. The important part, and I bring that up to say it is possible. This is not a crazy thing to imagine that care equality could be achieved. Where we have good data in households that have achieved that, there's typically lots of other things in the direction of gender equality that are worth calling out. So again, it's not just a simple indicator by itself, but it's so tied to gender inequality in the home and at the societal level, which is why we continue counting it. Next, please. COVID, as I said at the beginning of this, has been a huge wake-up call in terms of care. It's been a crisis of care, but we also see an opportunity in it. From data that UN Women has carried out in 47 countries looking at care and gender dynamics in the household, 56% of women say they have increased unpaid care work during COVID, as have 51% of men. It is interesting to point out, though, how big the difference is in terms of what, not interesting, it is imperative to point out the differences in terms of women's time devoted to it compared to men. Women reported increases of 5.2 hours per week in care work compared to 3.5 hours for men. When it comes to the care of our elderly family members, virtually equal numbers of men and women, 1 in 5 around the world, said they increased time devoted to caring for older family members. In these tragic numbers of COVID, there is also an opportunity. We have not seen, if decades, if not centuries, such an increase in men's participation in care work. Now, it is, of course, in the backdrop of this inequality that we will continue calling attention to, but it's no small thing to note how many men are doing more of the care work. That together, as we know, with the spike in men's violence against women around the world and all the other issues that I mentioned at the beginning, but we think it is worth calling attention to this historic opportunity to push ahead to achieve equality in care work. The next slide, please. Colleagues at the National Bureau of Economic Research in the US said, during the current crisis, many millions of men are on a form of forced paternity leave. Even while women carry a higher burden during the crisis, it is still highly likely that we will observe a sizable impact of this forced experiment on social norms and ultimately on gender equality in the near future. We, as the authors of the report, hope that that optimism is not unfounded. And we think that it is merited optimism if we do the work to promote care equality, if we put in place the policies to make care equality possible. The next slide, please. And that's why we've pushed toward thinking structurally. There's some amazing program work. The MenEngage Network, Alliance, and MenCare represent years of experience of programmatic work to promote men's involvement as caregivers. We won't give up on that, but we believe that we must frame that work, support that work, build on the work, and the important civil society activism, partnership from governments, leadership in some cases from governments, and support from the private sector in some sectors to say we need structural actions. We've proposed 7 of those, and I'll go through those quickly, and then we'll go to our speakers who will offer us comments on each of these 7 that we have put forward. The next slide, please. We think first and foremost needs to be a national care policy. Too often care is secondary. It's thought of in a piecemeal way. We are inspired by the national care policy, the national care plan in Uruguay that we'll hear from. We have one of its co-authors as one of our speakers this morning or today, and we'll hear from those examples. But we think governments, when we take seriously care work, we put in place the policies together with the resources to make it possible. We both build the intersectoral approach that it needs. We include access to subsidized childcare. We include targeted goals that say what we want in terms of coverage, what we want in terms of care equality. We expand pension plans to cover those who have been unpaid care workers at home. We make care professions valued and well paid and respected professions. And we make this part of national law, not something, as I said before, that's thought as an afterwards. Next, please. We make part of that care plan parental leave policies, not just for those in the formal workplace, but for those in informal sector positions. We don't just make it available for the middle class and for middle income countries, but we look for ways that paid care, that paid leave is available for all those who need it. The next slide, please. We update the data that we have globally on where leave is provided and available. 115 countries guarantee paid leave for mothers. That number has been fairly steady. There has been an increase in the number of countries that offer paid leave for fathers, but you can still see it's far less than those that offer paid leave for mothers. We think it is worth calling out that there's not even a very good counting of countries that guarantee paid leave for same-sex parents. OECD and the World Policy Forum, based at UCLA, have done some of the measuring of that, of which countries offer leave for same-sex parents. We think that is an area that needs far more attention. Our paid leave policies continue to assume heteronormative and heterosexual couples. As we expand them and as we push for expansion, we must not only, as I said before, make them available for low-income families in informal sector work situations, but for families in all kinds of family arrangements. The next slide, please. As we look at the days available for households, we also have to look at the fact that it's on average about 98 days of paid leave for mothers. That is around the 16 weeks that we propose as MenCare as a minimum. But as we look at the number of days for fathers, it is only 5. That number, we believe in a platform that promotes leave as paid, as equitable, as non-transferable, and that is available, as I said before, for family arrangements of all kinds. We think it needs to go with other workplace policies to incentivize it, to make it possible, to make it part of the workplace culture. And we'll come back to that topic as well. Next slide, please. 3, we think we must build on the important track record of social protection programs. We know that in many countries and parts of Latin America, Sub-Saharan Africa, parts of the global north as well, national social protection policies reach up to 1 in 5 to 1 in 4 households. They have worked to reduce the impact of poverty and sometimes inequality in some countries. For good reason, those funds, when they are cash transfers or transfers of resources, usually go to mothers. There are lots of good reasons to do that. But we miss opportunities to engage and support and nudge men toward doing more of the caregiving. A few countries are looking at ways to engage men, but far too few. 2 years ago, in collaboration with the Swedish government, we did a review of cash transfer programs, social protection programs, most of those cash transfers, that included or looked at engaging men in unpaid care. Of more than 150, we found only 4. It is important to note that among those 4, there was strong evidence that support for men, engaging men, putting messages out about men doing more of the paid care work did result in changes. That it didn't take a huge overhaul of such policies to nudge men, to support men, to obligate men to take on more of our care duties. We think during COVID, as we've seen social protection programs expand, they need to expand more, particularly to the most vulnerable workers and households, and they need to expand to be creative about promoting and pushing men to do more of the unpaid care work. Next, please. Our 4th recommendation is to use and transform health sector institutions, particularly the public health sector, to promote fathers' involvement from the prenatal period through birth and childhood, and continue to support men's involvement as caregivers. The next slide, please. The examples we've cited, because we don't find lots of other ones, have been in the case of Rwanda, where an evaluated fatherhood training program that's being carried out in collaboration and with community health public health sector workers has shown strong results. We present in the report results that we carried out an additional wave of data collection that is together with ROMREC that leads this in Rwanda, with Promundo and with support from the British government. We carried out an additional wave of data collection comparing the control group with an intervention group during COVID. In the control group, violence was higher, alcohol abuse was higher, men's participation in hands-on care work was less, violence against children was higher, whereas the intervention group, a group of families that went through the intervention 18 months back, had lower rates of violence, lower rates of alcohol abuse, higher rates of men's participation in care work, lower rates of violence against women as reported by women. We think it provides an example, and based on those results, Rwanda's Ministry of Health is partnering with ROMREC to look at scaling that up at a nationwide level. Brazil rolled out a nationwide men's health program in 1997 that has since gone on to reach about, and one of the centerpieces of that is a men's prenatal health protocol that looks at engaging men with women's support and approval, of course, and only with her approval. Is the man invited, the male partner, invited to be part of a prenatal visit. Recent survey research in Brazil carried out by the Ministry of Health found that about 75% of men are now accompanying in the consultation room their female partners, and about 2/3 are present at birth. Those are far, far higher than in the past decades in terms of men's participation, both in prenatal visits and in births. And we think it provides an example of how such programming can go to scale. Next, please. Number 5 is thinking about how do we promote an ethic of male care from early childhood onward. As I cited earlier, and as our data in the report confirms, these divisions in care work, this decentering of care, particularly in the lives of men, starts in childhood in terms of how we raise our sons and daughters in gendered patterns. We therefore believe that we need to figure out how do we in school and via sports programming and via media and culture, can we promote an ethic of male participation and full participation in care? Next slide, please. In the report, we cite the example of the Republic of Georgia, perhaps one of the few examples where a nationwide campaign showed measurable results in terms of men's and women's attitude changes about who's responsible for care work. It included the use of media messaging, books for children, encouraging fathers to read to children, but also to do the hands-on care. It was of a density and an intensity and with enough channels and ways that the messages were taking place that, as I mentioned before, it did not lead to care equality in the Republic of Georgia, but it did change social norms, at least according to evidence that we have and that we share in the report. We think we've got to continue to be creative. I want to note that that campaign was carried out in partnership with UNFPA, with MenCare, with the He for She campaign in the Republic of Georgia, and lots of NGO partners supporting it as well. It gives an example of the kind of multi-sectoral collaboration and partnership between government, UN, NGOs, the media sector that we need to achieve the kind of care culture change to make a difference. There's other examples that we provide in the report. We think there's opportunities to build into service learning for young people, into National Youth Corps, into programming in schools that makes visible for boys the need to make care part of our lives and centered in our lives. The next one, please. Number 6 is that we must change workplace conditions. We need to support the whole ILO decent work standards. There's no question that that must be the support for work that needs to be in place for workers in all countries. And we've got to have workplaces be allies in centering care in our lives. And we'll hear from some examples about that in the workplace and how the private sector can be a partner in achieving care equality and, again, centering care as it is and must be in the lives of workers. We know that workplaces must take seriously national mandates for care work, for paternity leave, for parental leave of all kinds, and must change culture, and that workplace leaders from the top of C-suites on downward must model that all of us are caregivers and workers. And to make that not just a one-off, one program, one training, but really to make that part of workplace culture throughout. And the last action point before we'll turn to our other speakers is to hold male political leaders accountable. For too often, the same way that we've seen care work as women's work in the home, women have also carried the political load. It has often been women politicians who have carried the load in terms of pushing legislation on leave policies, on support for childcare, on support for women workers and for workers in general. Much of that has been led by women. We need to continue supporting that. Of course, we need to move beyond the shameful place that we are in the world in terms of women's unequal participation in politics compared to men, but we also do not want to let men off the hook. We need male politicians to care about care, and we as voters and citizens must hold them accountable for that. We need to see male politicians voting for national care policies as much as women politicians and those of any gender identities do. And for the last point, before we turn to the other speakers, just to sum up where we are, if you'll go to the last slide, please. We, of course, start our conversations about individual men and individual households and individual women and the impact that this makes at the household level. But this really is our final message, that when done by individual men, caregiving changes those men, their families and their communities. When done by millions of men, it changes societies. And when taken up by state-level institutions, it shifts power structures. Not by itself, but as part of the still unfulfilled gender equality revolution led by feminist and feminist-allied activists, leaders, and civil society organizations around the world who have inspired this work. This call to action and these 7 structural recommendations are built on and come out of the foundational work of women leaders around the world who have called attention to the inequality in care work as a foundation of the gender binary and as a necessary step to achieving full gender equality. Thanks. I will end there, and I now get to turn the conversation over to 4 of our panelists. We'll shift off the slides, and we'll go to the full list of our speakers here. I want to introduce all 4, and then we'll start with Gabriel. Gabriel Corbo is the former director of the Sistema Nacional Integrado de Cuidados en Uruguay, the national care plan that I referenced before and that we cite as a case study and important example in the report. After that, we'll have Zara Nesbet Ahmed, who is the manager of Gender and Development Research at UNICEF's Office of Research in Inocenti. Then we'll have Alison Truman-Kamphaus, who is the global program leader of gender equality and community impact at P&G International. And then finally, we'll have some comments from Michael McCabe, who is the senior youth advisor at the U.S. Agency for International Development. Thanks all of you for joining us and agreeing to offer some comments and input. Your work collectively on these topics of gender justice and equality and accountability have inspired the work that is presented in the report. I will turn first to Gabriel. Gabriel, bienvenido, y muchas gracias por haber aceptado esa invitación. I'll turn over to Gabriel, who's got a presentation he'll share with us.
Gracias.
And I'll offer a couple of questions. Gabriel, tuyo.
Perfecto. Voy a compartir una presentación en función de las 2 preguntas que me formularon. Un segundito. Y antes que nada, para dar comienzo, les agradezco mucho la invitación de compartir nuestra experiencia y felicitaciones por el reporte y el esfuerzo que están haciendo por esta tarea tan importante y necesaria, más aún, como decía en la presentación Gary, en este contexto de pandemia. Rápidamente me han pedido que sea muy respetuoso con los tiempos. En función de las 2 preguntas que me formularon, era en primer lugar cuáles eran los elementos que contribuyeron a la construcción de un sistema de cuidados en Uruguay, y en segundo lugar, cuáles son en qué medida se dio resultados en la distribución del cuidado en los roles de género. Voy a comenzar con la primera pregunta. ¿Cuáles fueron los principales elementos que permiten que Uruguay es uno de los pocos países en el mundo que pudo construir un sistema de cuidados? Y tratando de ser conciso, ubicaría en 4 elementos. En primer lugar, las organizaciones sociales, el esfuerzo y la puesta en agenda de las organizaciones sociales de la temática del cuidado sobre en la agenda pública, digamos. En segundo lugar, el diálogo y la contribución de la academia, de los estudios académicos generando evidencia. En tercer lugar, el diálogo con estos 2 puntos anteriores de la agenda política. Y finalmente, una definición conceptual. Rápidamente voy a pasar los tópicos de cada uno de estos elementos que han sido importantes en nuestro juicio. En primer lugar, es importante entender de que en Uruguay la agenda del sistema de cuidados no nace de un partido político o de un conjunto de factores políticos, sino que la puesta en agenda de la temática del cuidado viene desde las organizaciones sociales, muy en particular de las organizaciones de agenda feminista, que comienzan a reivindicar hace muchos años atrás y a demostrar que hay una distribución desigual de los roles de género en la temática del cuidado. Esto ha sido acompañado, y creo que ha sido importante en el caso uruguayo, de un diálogo con la academia, con los estudios académicos, algunos de ellos producidos a través de organismos internacionales. Pero creo que la habilidad o lo que sucedió en Uruguay es que esa evidencia se puso en construcción colectiva, en muestra colectiva de lo que estaba sucediendo. Muchos de los datos que mostraba recién Gary actuales los estábamos viendo en Uruguay hace bastantes años atrás. Un ejemplo de esto son las encuestas de uso del tiempo, por ejemplo, que mostraban datos bastante similares a lo que recién mostraba Gary a nivel mundial. Estos dos elementos fueron comenzando a construir, sí, una agenda política, y en el gobierno del 2010-2000, o sea, estamos hablando de 10 años atrás, en el gobierno de la administración del 2010-2014, empieza a darse una necesidad de definir conceptualmente el sistema de cuidado, generando debates, construyendo algunos programas pilotos, que dieron base para que luego, en el 2015, finalmente se decida crear un sistema de cuidados. Con esto quiero decir que esta construcción no fue de un día para el otro, llevó muchos años de una construcción de debate entre las organizaciones sociales, la academia y el sistema político, hasta que finalmente en el 2015 se crea por ley un sistema de cuidados y que tiene su primera experiencia en el gobierno anterior en un plan de cuidados. Cuando el Uruguay decide construir un sistema de cuidados, más allá de la voluntad política de las partes de dar un presupuesto y una asignación específica y una institucionalidad, a nuestro juicio, nuestra experiencia, fue muy importante y llevó mucho trabajo definir conceptualmente qué era este sistema de cuidados. Y esto daría para mucho tiempo de presentación, pero básicamente lo que quería rescatarles es que en el caso uruguayo, en el caso de nuestra experiencia, fue definir, si bien el cuidado siempre está presente en nuestras vidas, desde que nacemos hasta que morimos, desde el punto de vista de una construcción de la protección social, nosotros lo definimos como un cuarto pilar de un sistema de protección social. Esto, y con esta imagen, que voy cerrando esta primera pregunta, en el caso del Uruguay nosotros tenemos 3 grandes pilares de protección social, del punto de vista del Estado, de la protección del Estado. El sistema de salud, el sistema educativo y la seguridad social. desde nuestra concepción, el cuidado es un cuarto pilar, pero a diferencia del punto de vista institucional, a diferencia de los anteriores tres, entendemos que de alguna manera es transversal, o sea, atraviesa a los otros tres pilares y por lo tanto conversa, genera diálogos y articulaciones con la salud, con la educación y con la seguridad social. Esto cuando pasamos a la etapa de diseño y a las acciones puntuales, esta definición conceptual permite definir límites, pero a su vez, en la experiencia nuestra, nos ha llevado que algunas veces esos límites de acciones entre un sistema, entre un pilar y otro, a veces también son difusos. Digo, como una experiencia para otros países que estén construyendo sistemas similares. Rápidamente, no sé cómo voy de tiempo, cualquier cosa me avisan, o me paran cualquier duda. Con respecto a los resultados, ¿qué pasó? Si realmente el sistema de cuidados contribuyó en la mejora de la distribución de roles, en lo que preocupa en términos de la equidad de género. Bueno, los resultados no son del todo precisos ni tampoco son del todo buenos. Es cierto que cuando estábamos terminando nuestro primer quinquenal, que fue en el año 2020, bueno, se da un cambio de gobierno y además de eso, como todos sabemos, comienza la pandemia, que obviamente no estaba en ninguna planificación de todos nosotros. A su vez, como presentaba Gary, la pandemia además ha profundizado estas inequidades en términos del trabajo no remunerado y la distribución del cuidado. Ahora, ¿qué aprendizajes, desde nuestro punto de vista, y como decimos aquí con el diario del lunes, podemos sacar de la experiencia y qué aspectos tal vez no fuimos del todo buenos en la construcción de esta equidad? Nosotros, en el trabajo de la corresponsabilidad, el trabajo de cómo se promueve la corresponsabilidad de géneros en términos de cuidados, nos parece que este orden es el orden de la agenda más importante, la sustentabilidad social de la agenda, la sustentabilidad política y la sustentabilidad económica. ¿A qué me refiero con esto? Nosotros en la administración, en la creación del sistema de cuidados, teníamos una oportunidad que tal vez no se repite muchas veces en la historia, y teníamos un gobierno dispuesto a montar el sistema de cuidados y a volcar presupuesto, y un presupuesto importante. Eso nos llevó a que tal vez hicimos un esfuerzo muy importante en energía y en recursos, en crear servicios y en expandir servicios de cuidado, entendiendo que había una oportunidad importante y necesaria. Pero el esfuerzo, tal vez en el cambio cultural, en la construcción del trabajo de la corresponsabilidad, si bien lo hicimos, tal vez fue bastante menos que el esfuerzo que hicimos en la construcción de los servicios. Creo que como aprendizaje, eso, si lo tendríamos que hacer de vuelta, yo creo que haríamos cosas distintas. Tal vez menos esfuerzos en servicios y mucho más en el cambio cultural. Nosotros definíamos que el sistema de cuidados tenía un conjunto de componentes de trabajo, que eran los servicios, la regulación, la capacitación, el entrenamiento, la comunicación, la información y la generación de conocimiento. En todos estos componentes, uno analiza el esfuerzo de energía y de presupuesto, nuestro mayor esfuerzo estuvo en los servicios. Sin embargo, nuevamente con el diario del lunes, les diría que todo el trabajo de seguir generando información, seguir generando conocimiento y comunicación es un esfuerzo en construcción de la sostenibilidad social, tal vez sea más lento, pero que permite posiblemente mayores cambios y duraderos. Nosotros generamos muchos servicios, vino la pandemia, pero en definitiva esos servicios no estaban preparados para un proceso de pandemia y en muchas cosas hemos retrocedido del punto de vista del cambio social. Entonces, la corresponsabilidad, recién mostraba Gary el trabajo del reporte, para nosotros tiene que ver cómo se trabaja en el interior de las familias. Creo que en eso debimos haber puesto muchísimo más esfuerzo del que hicimos, cómo se trabaja a nivel comunitario y cómo también, me parece muy bien lo que ustedes planteaban, en términos del sector privado o el mercado. Si bien nosotros hemos hecho acciones en estos tres aspectos, nuestro mayor esfuerzo estuvo en la generación de servicios, sobre todo desde el punto de vista de la regulación y de la generación de servicios desde el punto de vista del Estado. Entonces, de alguna manera, como aprendizaje es, estos elementos de la corresponsabilidad deberían ir bastante acompañados y no uno diezmando al otro de alguna manera. La sustentabilidad política, y voy redondeando. Si bien la ley de cuidado, ¿cuánto me queda? ¿Un minuto?
Un minuto.
¿One minute?
Sí, gracias.
Ok, 1 minute. Thanks. La sustentabilidad política, si bien la ley de cuidado fue votado por todos los partidos políticos, hubo un cambio ahora en el 2021, en las elecciones del 2020, perdón, un cambio de visión política. Hoy gobierna otra coalición de gobierno con otros pensamientos, y si bien el sistema de cuidados no se destruyó, sí se bajó la energía y queda la duda también qué sucede en este proceso de pandemia. Por lo tanto, la sustentabilidad a nivel del sistema político no fue un elemento también con el diario del lunes, como decía anteriormente, suficientemente trabajado. Y esto, y aquí redondeo, Gary, por último, la sustentabilidad económica, que tiene que ver con lo anterior. Como dije anteriormente, el anterior gobierno tuvo una decisión de invertir mucho presupuesto en la creación y en los cimientos del sistema de cuidados, pero a nivel de la sustentabilidad política eso no estaba garantizado. En este cambio de gobierno se ha reducido sustancialmente la inversión de lo que es el sistema de cuidados y si bien no se destruyó, queda la duda si efectivamente se va a continuar, más allá de que con la pandemia todo está muy, muy raro en términos de las situaciones. No queda claro si este sistema va a seguir fortaleciendo o directamente está reduciéndose. Por lo tanto, sustentabilidad social, sustentabilidad política y sustentabilidad económica. Dejo por aquí para respetar el tiempo y muchas gracias nuevamente por su atención.
Muchas gracias, Gabriel. I just wanted to comment, and maybe we can come back toward the end. I think the question about financing, political sustainability, who the allies are, if a national care system can survive changes in government from a more progressive one that created it to a less progressive one that is now in charge. I think those are key questions, particularly as we've looked at Uruguay as a model for how to create an integrated care system. Thank you for sharing that and for the nuances on that, Gabriel. I'm now pleased to turn to Zara Nesbit Ahmed. Zara is with the UNICEF's Research Center at Inocenti. If we can highlight Zara, great. Thank you. Thanks for joining us, and thanks for your comments on the report as well. Appreciated those. I'm going to pose the two questions for you rather than back and forth. One, we've seen, as we talk about in the report, and Inocenti Center has talked about in your research, the historical devaluation of care being spotlit during the pandemic. And we've also seen some hopeful political commitments in some places towards supporting the care economy. So first question to you would be, what commitments do we need for governments in terms of care policies? And the second, you've done lots of work on, and the Inocenti Center as well, has been to call attention to how we take these conversations about care equality and engaging boys at younger ages. How do we build this into what we do with children? Often the work starts with adult men. What can we do at younger ages? Zara, over to you.
Thank you very much, Gary, and to the team for this invitation, but also thank you and congratulations on the report. It was really great to read and have the opportunity to comment on. And I also just want to say thank you to Gabriel for his presentation. At Inocenti and with GRASS, we're actually also looking to research Uruguay's system. So it was amazing to listen to and hear his insights. So regarding the first question around the historical devaluation of care, and how decisions now can be informed by feminist frameworks, I would say First, that it's clear we need to rethink what the economy is for, and from a feminist perspective, and what it is that we really value. And again, this is where feminist thinking comes in. So you mentioned it, Gary, when you gave your opening presentation about how it is that we put care front and center in policies and in creating fair and just economy. And I'd also add, it's about, and if we're going from a feminist framework, it's about imagining and creating a different type of world that not only puts care center, but also values care. And the concept of care isn't new. It's been around in feminist thinking for decades, where a lot of feminists challenge deeply held beliefs around who naturally was meant to do care in the home. And feminist economists, Nancy Folbert, Diane Elson, and more have been working on this and challenging the perceived low value of care. So the first point for me is put care center. The second one, from a feminist perspective, I would say, is around drawing on the triple R framework, which is something that your report does. So there's the recognition, the reduction, and the redistribution. Particularly, redistribution is quite important to ensure that the care is shared within households between women, men, and families. I'd also point here that we should complicate the notion of a one-way flow of care. So recognize that care is intergenerational, it's gendered, and that it's not only, for instance, women and girls, but men and boys and older women. They can both be caregivers and care receivers. So how we view who is giving and receiving the care. The last presentation touched upon it, the questions of sustainability. But I want to add an additional point around sustainability, in that the pandemic and COVID has shown the increasing number of men and boys that are providing care and engaging in unpaid care work. But there's the sustainability about ensuring that this equitable sharing continues beyond the pandemic. So again, that goes back to my first point about, if we value care, and we see it as critical, and we see it as skilled work, we could have more of that. Beyond the 3 R's, the recognition, redistribution, and reduction, it's also important from a feminist lens for 2 additional R's. One is around representation, so actually representing carers in relevant policymaking settings. So whose voices are being heard? And also reward. This is when we go beyond unpaid care to paid. So rewarding paid carers as part of a decent work agenda, which I believe was also mentioned earlier. My next point would be around how it is that we consider care, not only through the lens of gender, but this pandemic particularly has shown other types of inequalities around race, around ethnicity, around migrant status, and how that also impacts whether care is recognized or not, but also how people are affected by care. So recognizing these different inequalities, not only across countries, but even within countries. 2 points I will put together is around the intersection between the crisis of care and other structural inequalities. So from a feminist lens, a lot of feminists have been working towards looking at the links between care crisis and the environmental and climate change crisis. And finally, I would say advocating for greater public investments in care. And here is where social protection comes in, and cross linkages between different sectors. So between the gender equality advocates, child rights advocates, social protection specialists, to begin to start seeing how bringing these different actors together. And the pandemic has seen an increase in investing in social protection. A lot of countries put in place some sort of provision in response to the crisis. But when we look at it from a care lens, less than 10% have addressed unpaid care work. But still, there are some promising examples. So for instance, the social protection that addresses care would be one where they extend paid leave to ensure that the time for care and the care is shared equally among partners or carers, again, which is something that was mentioned in the report. There's also social protection around financial provision, so ensuring different allowances, both contributory, such as cash transfers, or non-contributory, such as pensions. They actually provide benefits to strengthen the economic security of those who require or pay for services. And the last one I would say is accessible and affordable and good quality childcare services and educational services. I will then go on to the second question, which was around starting from an earlier age. So moving beyond just only engaging men, but how do you start from early childhood onwards? So at Innocenti, and building on my last point around social protection, we have been leading on research funded by the UK's Foreign Commonwealth and Development Office, looking at the role of gender responsive and age sensitive social protection for addressing gender inequality. And your question and what the program we're doing brings up the importance of looking at these issues of care and gender responsive social protection across the life course. We already know that adolescence is increasingly being recognized as a critical period for forming one's gender identity and adhering to certain types of gender norms. But we also know that more evidence is needed on, if we look at gender equitable masculinities, what are those impacts on adolescent boys, for instance, or boys in early childhood. So a life course approach is important, first because evidence shows that women, boys, girls, men all face different risks and vulnerabilities based on what stage they are in the life course. But also we know that norms differ at different stages of life and exert different influence. So if we look at early childhood, for instance, younger children learn more about gender norms and roles by observing the roles of men and women, family members that are around them. But also more increasingly, media and interactions with people outside of their family is quite critical. And we also know that gender norms are less fixed in early childhood, and they become a bit more fixed in late childhood and adolescence. So one way is if a lot of these behavioral change programs and policies start engaging with younger boys and girls through different types of activities, through education. It's one concrete expression would be, for instance, in changing attitudes around gender equality, or also the nature of boys' relationships with other members of families that are women or partners or other girls in the community. Very interesting ODI's GAGE program, the Global Adolescence and Gender Evidence Review, I believe that's what GAGE stands for. They looked at existing evidence around adolescent programs in about 50 plus countries, and they would be able to tease some of these strategies. And one was around gender equitable attitudes. They also found some changes around gender division of labor between boys. But also one thing to be clear of is around backlash, where there are a lot of young boys who exhibit more gender equitable attitudes. Sometimes in some countries or regions, they could experience some sort of be teased or be seen as effeminate. But from that GAGE study, and also from what we're finding out in Innocenti, more times than not, there's more positive responses towards those actions. And I will just end, because I'm aware of time, and just say, particularly in the context of COVID, UN Women did a study as part of their Women's Count program. And they did find in Bangladesh, the Maldives, Pakistan, and Philippines, while women were more likely than men to report an increase in their unpaid care work since it started, depending on the country, 35 to 80% also noticed that their sons helped more than before. So which goes back to, one, the pandemic has led to changes, but two, how do we ensure that sustainability? I will stop here, and very happy for any questions during the Q&A.
Great. Thank you, Zara, for those reflections. And I think particularly setting out much of the work from your centers inspired our recommendation around number 6 of how do we change that ethic of care, and what's the dynamics in early childhood and adolescence that are so crucial. And thanks for the reminder of the foundation that this report takes, which is on the important work of the 5 R's and how feminist activists and economists have called for the recentering, the centering of the care economy. So appreciate your comments on that. Thank you. Turn now to Allison. Allison, and we're pleased that P&G has been a partner on dissemination and getting the report and these conversations beyond some of the bubbles that we stay in to getting a conversation in broader society. Thank you for that collaboration. Want to turn the two questions to you. Is that the pandemic really has belied this reality that somehow our work lives and our care lives are separate, and is transforming how we think about care. And would like to hear you talk about how P&G has responded to that reality, both in terms of your messaging to the world, but also as a workplace that that has so many individuals who also have care duties there as well. And then I think Zara's comment before of, the data she cited from UN Women of one region in the world, but we've seen this in other parts, of how much COVID is nudging us on care work and could be part of a radical transformation of how we see care. While we can't, generalize this, I think we don't want to generalize to, all brands out there and all corporate sector partners, but would like to hear your thoughts on how we can turn up the volume to see that this change that's happening during COVID sticks, that it goes ahead, that it achieves the equality we're after. So with those two big questions, over to you.
Thank you, Gary, and thank you everyone for joining. It's a pleasure to be here. We've admired Promundo and the MenCare platform and all the work that the network has done around the globe. And I see many people back in the office, but I also see many of you still living at work here on Zoom today. So Gary's questions are very apropos for us to talk about. I'm here and proud to represent P&G because we are a bit of a unique position as COVID happened. Our global business, makes health, hygiene, and cleaning products around the world. So we were in a bit of a privileged situation in that, our business model was not, turned upside down. Certainly we had new ways to learn how to work. But throughout the pandemic, starting, from our business in China and then throughout the globe, we focused on three main priorities, which was the health and safety of P&G people, making sure that our health, hygiene, and cleaning products were available around the world, and then supporting communities, especially those that were disproportionately affected by COVID. And we did learn a lot along the way. Certainly, what was unique about our workforce and our employees is that 2/3 are operating in sort of frontline roles in our plants and operations. And then the rest of our workforce would be more in the, flexible work from home transition. So we had both scenarios going on inside the company, and we did learn a lot. We certainly saw that more holistic support was needed for our employees. We certainly learned that we could progress work remotely, we could lead, the flexibility is something that we should not unlearn. And that will be important for not only women, but, men and those who are caregivers around the globe, for us to keep that in mind, that we can succeed. And we've had a very successful year for the business, but also ensuring that we maintain and retain our employees. We stayed very close to data on our employees and surveys, and we adapted many of our previously existing policies, which I think we will not go back to some of the, scenarios or the ways that we thought about work before. So I do think this is a pivotal moment for us to, think about choosing equal as we go forward. And that's one of our latest films that we've created, is to do just that, to choose equal at work and at home. I think digital technologies will help us continue to do that. And I think we also stepped up in the policy space. We had already started, but continued during the last 15 months of COVID to roll out our global parental policy. And that was just one example of how we're shifting our policies from being, gender through a gender lens. We have parental policy now everywhere we operate in the globe, and it's equal everywhere we are now. And it's a standard for all parents and inclusive of adoptive parents, birth parents, first and second parents in the home. And so we believe that, these policies are important because men and women have an equal role to play at home. And we also want them to have a full and rewarding career. So as you said, Gary, I can't really speak to all industries across all the private sector, but we do believe that, together companies, working with governments and across sectors, we can build more equitable structures and sort of create those societal and systemic changes that we want to see. One note from our experience with parental leave, and especially, working to change the culture in, both inside the company and outside in some cases, those cultural norms are very strong. We've recognized the value of having men take their full leave. We know the benefits. You've shared them in the State of the World's Fathers reports in your progressive chart earlier today about what those benefits look like. But as we have more men, take leave, And, they go through a lot of what women go through in the workplace of securing approvals, creating the plans while they're away, especially when they take a full allotted time of leave. And so re-entry to the workplace, it just builds more empathetic managers and inclusive leaders. And then that can also help us, adopt more structural changes. So all of those things are important and things that we've learned over the last year. I think your second question is a really important one because the policies are important, certainly. And we are seeing more, the Care Economy Business Council here in the US is forming with many companies, including Promundo as an organization who's supporting that. But we also, I think, see the opportunity to make some shifts in culture because we haven't had in a very long time sort of the world in totality sort of experienced such an abrupt a disruption like we have over the past year. And so, we recognize the deeply held gender biases around the world and how, a big part of our business is through media and advertising and communications. And so, this is something that we've been focused on for quite some time. And we've seen your data and many others that show just how much more women are doing. But we've been very focused on sort of some myths that exist that are holding us back from gender equality. And a really important one, there's actually two parts to the myth that we see. And it's, this myth that women own the responsibility primarily for home and family. And then the other myth that, that's quite pervasive, not to those on this call, but in society at large, is that men don't want an equal role at home. And both of these are false. And so, we are trying to work through the voice of our brands, and there are many around the globe who are stepping up to accurately portray the involvement of men and boys in care, because we recognize that those images that are created can really shift the norms around the globe. So whether it is, men, changing nappies or diapers, or you see them, Swiffering floors or washing up. And then I think probably the one that has the most, data behind it, and we've replicated around the globe, is the Ariel Share the Load campaign from India. And this has been a very deliberate, intentional 6 years now campaign. It started with a question about inequality in the home in 2015, and is laundry only a woman's job? And then it moved to looking at the generational cycle about dads sharing the load. Then we moved to sons, which is really important from what we just heard from Zara. How do we tackle sort of the discrepancies that emerge in the home at a young age between boy children and girl children? And then I think, the most recent one during COVID was Share the Load for Equal Sleep. And that was demonstrating that while men may be taking on more in the home, women were still, through their domestic load and the unpaid care work they were doing, were actually getting far less sleep. And that actually struck quite a nerve in India. And I think the encouraging thing that we're seeing is we've been measuring along the way sentiment and social norm in India and beyond. And, we've seen from 79% in 2015 of men who thought that laundry or domestic chores were only a woman's job in India. That's dropped in 5 years to 41%. Now, there's many, many influences in that number, but, the more through, broad media attention and shifting the narrative around men and caregiving and boys and empathy and all the things that, we see in the report, and especially action number 5, we are looking to expand that, as rapidly as we can around the globe. Here in the US, we had a Come Clean to Close the Chore Gap equivalent of that that ran right before the US Super Bowl, the American Football Championship back in February. And so we're continuing to look across all of our media partnerships and content partnerships that we have to look for opportunities with, the very important, research-based data. And this report will provide us with much more of that. So I'll stop there. Just those were, 2 insightful questions about what we in the private sector can do through our core businesses, and not only with our employees, but the influence that we have in the world. And we're proud to join you in disseminating this report and making it something that, we hope will gain additional traction, and that we can take this moment from COVID and look ahead to, maintaining some of the new patterns that may exist for men and other caregivers around the world.
Thank you, Allison, for those comments and the examples. I think the the partnership and the accountability with workplaces and the corporate sector is vital to this work. And we certainly see it as connecting up to being supportive of the state level policies we need to make leave and other care policies ongoing and sustainable. And then the changes in workplace culture that you highlighted, the internal consistency that you walk the talk in the workplace, we think is also key and a necessity for all workplaces to take seriously. And then the importance of your voice as shaping culture, in terms of the reach of what you do in your messaging, we think is also key to continue to model intersectional equality. So thank you for the comments, and we look forward to continuing to grapple with these not small things of how to do the partnership and the accountability at all those levels. Thanks for the comments. Turn last for some brief comments from Michael. Michael, as I mentioned before, is the Senior Youth Advisor at the U.S. Agency for International Development. Mike, would love to hear, we know the change in administration has meant far different conversations about care work at the domestic level and a change in U.S. governmental policy in terms of foreign assistance and participation in international development, how issues around gender equality are seen. We know that in 3 minutes you couldn't talk about all that, but would love from the perspective of the important work that USAID has been doing around gender justice and gender equality, and also around promoting healthy masculinities and gender equality in some of the youth programming you do. So briefly, if you could share with us, where lots of eyes on the US going into the Generation Equality Forum, and also eager to hear examples around taking some of this successful programming into systems, into the policies that we need to change. So I know that's a tall order in 3 minutes. Yeah.
Great. Thanks so much, Gary. And congratulations to you and the Promundo team for a fabulous, groundbreaking report on the state of the world's fathers. For those watching, I met Gary first 30 years ago in 1990, late night on the streets of Bogota, when I was working with UNICEF, and we were doing street outreach together with one of the pioneers of street-based work named Don Mago. And as we met with a lot of these young people, they all called Don Mago their surrogate father. And these young people who've been too often victims of a broken system and lived on the margins of society, nonetheless wanted and needed that caring adult and father figure to believe, someone that believed in them. And we've come a long way since the alleys of El Cartucho, but not to mention that we both ourselves have become fathers of young adults. But for the Biden-Harris administration, as well as USAID, we, as you said, have an increasing focus on that attention to the importance of the care economy and on the healthy development of children and youth and families. And as mentioned, this is going to be a key theme of the Generation Equality Forum. It's pivotal to so many of the other components of gender equity and equality. So in addition, I want to talk a little bit about what we've done around, for example, in our plan of action for children in adversity, that actually 2 of its pillars focus on strong beginnings and family strengthening, and how that plays a role cross-cutting across all of our work right now, as well as our work on gender equity and GBV reduction through parenting and family communication strengthening. And lastly, you may ask why the youth coordinator is talking about this issue. It's because as we look at young people, and we define that 10 to 29, these are the young parents, the young fathers that we most want to be engaging and changing these transformative attitudes towards gender equity and the care economy. So our focus on fathers really takes this cross-sectoral ages and stages approach that addresses some of the recommendations in the report, such as number 3 on expanding that social protection to redistribute that care and strengthen that care economy. A couple of things that are coming out that I think are really going to help around this. The new Global Child Thrive Act, approved by the House of Representatives this year, is a commitment to improving early childhood development around the world and includes a focus on support for parenting and childcare. In East Africa, USAID over the past decade has really advanced our work through what we call the Real Fathers Initiative, which has been a heavily evidence-tested model for how do we engage young fathers more effectively. So for example, it's now expanded into Rwanda, where it addresses intrafamilial violence, family communication, gender distribution of care work through promoting these improved parenting techniques, use of nonviolent discipline, responsive caregiving with fathers, etc. And our evaluations have found in multiple countries a significant drop in terms of intimate partner violence, use of physical punishment against children, as well as increased communication between couples and attachment with children. Similarly, we just partnered with Lego Foundation, and through the Sugiura Moriango family strengthening model, we've been able to pilot and test and are beginning to scale this model in Rwanda. In Central America, our projects that are focusing on violence prevention, as well as in the Caribbean, through our Youth, Families, and Community Project, have really worked to reduce youth violence by going upstream and strengthening the local system for professionalizing a network of family counselors to work with fathers and mothers to improve that support and that caregiving, especially in communities impacted by violence. But we recognize this is a collective impact problem and challenge that requires all these donors and partners working together. So later this year, we're looking forward to hosting a parenting summit between USAID and PEPFAR, WHO, and others to really bring together and build upon some of the findings of and recommendations of this report, as well as to look at really where we go on positive parenting and family strengthening programming. So we're excited about the direction it's going, and this sort of research really sets the base for us to build upon. So thanks.
Thanks, Mike, and thanks for sharing our personal journey into this political cause, and thanks as well for sharing what this administration is showing in terms of commitment on family strengthening and support. And if we had longer time, we would talk about some of the important issues around the care economy at a national domestic level in the U.S. and how important that is. But appreciate your comments and reflections. We're a little bit over. We want to, we've got breakout sessions, but did want to open up for a few questions that, as appropriate, we'll hand over to any of the speakers. So if folks we've got 5 minutes. I'm looking to APTA to see if that is correct, if we've got 5 minutes for a few questions.
Yes, that is correct. Thank you.
All right. So if specific questions to any of the speakers or the report, we will also have an opportunity for some geographic regions discussions in the breakout rooms. But for the moment, if there's any questions, that'd be great.
Hi, Gary. This is Apta. I see one in the chat. Just to ask a question to the group as a whole, it's not specified at anyone. Are there advocacy tools to work with governments? For example, in the Dominican Republic, labor law only affords 3 days for fathers after a child is born.
Yeah. Zara, might I pitch that to you, or I can also comment on that?
I was just reflecting that it's a very good question, and I was trying to find examples because we've actually done a recent study with UN Women actually that looks at different strategies that governments are using to mainstream gender into social protection. But I'm trying to think of examples from a engaging men and boys perspective. So if you can give me a second, or I'm very happy to type it in the chat, as not one is not coming to mind instantly.
Yeah. There are, I'll jump in, and maybe APTA or IMPO as co-coordinators of the MenCare campaign. There are some resources available on the MenCare website, and in the report itself, we provide what we think are kind of the must-haves for parental leave. But I think there's some other tools that are available on the MenCare website of kind of recommendations for engaging men particularly around ECD. I'm not sure if Allison or Mike, you want to comment on that as well, or we could wait for if there's another question here. There's a post to the MenCare website for some of the other resources that are available there.
Correct. Thank you. I'm not sure if anyone else wants to answer the question around advocacy. I'm looking at the chat and I see additional questions around working in countries with perhaps more conservative tendencies, including those that may have a large kind of background in concentration around religious concerns. Is there anything that we can talk about in terms of the ways in which some conservative governments or advocates can work with those in those communities?
Yeah, I don't know if Gabrielle might want to, the challenge there has been how to sustain a progressive platform after with a change in government toward a more conservative government. How do we maintain the gains of care policies afterwards? Gabrielle, not sure if you want to comment on that or anyone else.
I believe that Gabriel had to drop off at 10. So if anyone else wishes to take on that question, I don't know. Yes, Allison, would you like to go?
Yeah. I have an example that's slightly different than engaging governments, but it's sort of in this context of cultural relevance and context and challenge. We have found in hiring women to achieve our goals of having equal representation at all levels of our company and across all the different functions is, we've done some work in Pakistan as one example where we've had recruiting where we've engaged with family members of potential candidates to come and work for P&G, and we actually have it's less of a recruiting visit for the individual and more so of the family, the broader social influence on that potential candidate or person that would be coming to work for us. I think that's one way that we've tried to bring visibility to what may be not necessarily seen or understood in kind of how the our workplace and the policies, will be an inclusive and, safe and, an environment that will be acceptable. And that goes across not just in our office spaces, but also in our manufacturing and plant environments as well. So that's one way we've done that. I think the other comment is with, for example, the global parental policy that I mentioned earlier. We do not know when that first father, let's say in, for example, Saudi Arabia, who works for P&G, may take that opportunity. But you can rest assured, as we've implemented this policy around the globe, we have been very intentional in the communications that we've had within the company and beyond in a way to make sure that the cultural shift that's taking place, it's one thing to put a policy in place if no one takes it. It's another to, encourage the cultural shift and change that makes that the norm. And so, all of those examples, especially when it can be in, cultures or communities where it is not the typical, standard expectation for people to do that. It's important for us to, have those stories, share those stories. We have a Share the Care video that we have on our global YouTube page that shows a wide, diverse collection of fathers all talking about the benefits of them taking the parental leave to date, and it includes some of the benefits that Gary mentioned earlier. So we're trying very intentionally with our communications to help shift some of the sort of cultural reservations to what we've talked about here and in our workplace as well.
Thanks. And I might add, I think the challenge of conservative settings, in some cases that's a conservative backlash, in some cases it's a conservative portion of populations that has been and often voted against the equality platforms that we believe in. I think we've seen lots of examples at state, municipal, provincial level, even in countries that have had national level conservative policies. You might look at India or Brazil at the current moment, or US during the previous administration and other settings, and think that all policies go in some uniform backlash direction. But in fact, there's been some valiant efforts to keep ECD services and childcare and pushes toward equitable parental leave at local levels. And I think, Allison, you give the good example of leadership by workplaces that have a strong role in their communities to say, we're doing this, even if national policy doesn't go in that direction. Our colleagues at Sonke Gender Justice have done lots of interesting work and important work in South Africa on ways to engage religious leaders, engaging with those who are progressive and do support this agenda, to kind of belie the notion that there's any single religious group that's opposed to this, or even that politics is always so uniform. So I want to just highlight those examples. I want to close with one question. Sure, Mike, go ahead.
Yeah, no, just one other point to think about it. I mean, part of it is also seeing how different policies are complementing each other along this continuum. And obviously, our focus today is on that childcare and equity in the household. but linking it also to that continuum of how we're improving early child care as a sector. The World Bank has done some really good research recently through its Better Jobs for Brighter Futures and investing in childcare to build human capital. That really shows that connection between that early year in the household, and then how do we connect that family to better quality childcare in the community to support that as they go across that continuum. So I think working together on these policies can really support a national strategy in many more countries. So
thanks. I'm going to pivot now because we do want to go into some conversations with, and apologies that I need to move on given time. We're going to move into the group discussions where you'll have chat rooms, and so I'll hand this over to Apta. But I want to take one of the questions that was offered there about reminding us that we started MenCare as a global platform on equitable parenting and equitable care work 10 years ago, and a question from one of the participants around, do we see optimism for where this agenda is going? And what do we see as some of the major things that give us hope or concern? And precisely, we hope that this report is a 10-year challenge to us in trying to find the glass half full with what COVID has meant of more men doing hands-on care work and children seeing that and experiencing that, but also very mindful about what our biggest concerns and barriers still are. So what I'd like to do is propose we take that provocation into the breakout rooms. And I noted a couple of folks who did have their hands up, and I will take those into our final comments. But Apta, I want to turn it over to you so we've got time to move into the breakouts. Just very quickly, we'll reiterate this at the end, but just want to thank all the speakers and commenters up until now. Apta, over to you.
Thank you so much, Gary. And thank you to all our panelists for their time and for sharing these important insights on how we can move forward. The work doesn't stop here, though. And just to note that we as MenCare want to be able to use our collective expertise, experience, and power to continue to push forward. And when I say MenCare, I don't mean Promundo, Sanke, MenEngage, I mean all of you. With that, we're going to transition into the next session, which will allow us to break into regional breakout rooms. So you'll see options to opt into a room labeled with the different regions that MenCare and MenEngage work in. You may choose to join the breakout room for your region or another if that is where your primary area of work or interest in study is. Once in the rooms, you'll have we're going to look at, given time, we may reduce to about 30 minutes to work with facilitators of that room to discuss the 7 action points presented earlier and to think about what if any, strategies and ways to garner commitments in your country, your region, or internationally around caregiving. This will not be the last of any of these conversations that we'll be engaging in. This is going to be one of many as we lead up to the Generation Equality Forum and beyond Paris. The 5 breakout rooms will be, the first room will be in Latin America and the Caribbean, facilitated by Francisco Aguay and Douglas Mendoza. There will be another breakout room dedicated to Europe, Eastern Europe, Western Europe, and the adjoining region, facilitated by Lina Walkis from Sweden. We'll have another room dedicated to the Middle East and North Africa, facilitated by our colleagues Anthony Kiri from Abad, and we will also have another room dedicated to North America and kind of other regions here, facilitated by myself. In the main room, if you wish to stay in the main room, this room will be dedicated to Sub-Saharan Africa and will be provided with interpretation in both English and in French. I want to give 1 minute for any questions that anyone may have before entering into the breakout rooms. But if not, you can begin to start going into the room of your choice. You should be given an indication of which room you wish to join now. Thank you, Umpo. Thank you to everyone who was able to join, and I hope that these conversations continue going forward. I'd like to take the last couple of minutes we have to just kind of share a really quick synopsis about what we were able to discuss. Maybe I'll start with Umpo just to give us a little bit of a sneak peek about what was discussed within the Sub-Saharan Africa or the Africa Regional Room. After that, I'm happy to share from North America, and then what I'll do is maybe pass to Lena, and then to Pancho and Douglas, and then finally to Anthony. Is that does that sound okay?
Yes. So I'll be brief. I think most of you did hear a bit of what Sub-Saharan Africa has in store. But for me, I think there was consensus that all the 7 actions are very important for Sub-Sahara. And some of the key ones that came out were, working with holding male policymakers accountable. That's one that really kind of stood out, to say we need to hold our leaders accountable in this work. And also, we also spoke about how, Sub-Saharan Africa is largely defined through religion and culture. So that's another area that we really need to focus on. So in a nutshell, these were the key highlights. I know the recording will share more information.
Thank you so much, Paul. I think for those, I mean, if you would like to share your information in the chat for those who want to kind of continue the conversations forward, that would be wonderful. I'll share a quick synopsis about my breakout room, which was we highlighted some of the challenges around kind of centralized organizing around parental leave or social protection programs, given a lot of the kind of the political and ideological battles that can happen, making unpaid parental leave a cause for for some groups and some and promoted by some activists, versus if others are in political spaces that don't necessarily believe in the same values that we do, can undermine those same practices and values. And so how do we counteract that, or how do we move forward on building these policies, even though they may be undermined by others? And so I think a lot of the conversation was, how do we promote kind of that buy-in or that value for care moving forward? So that's kind of where we were able to discuss in our breakout rooms. I'll pass it now on to Lena to share from Europe.
Yes, thanks, Apta. And we were just about to get started in our conversation. But in terms of prioritizing between the different action points, I think that there was, it was interesting that it was the really broad work on changing gender norms that stood out as the one that seemed most prioritized in our group and that many highlighted. And apart from that, it was also mentioned the work with, of course, to push for gender equal parental leave, and also on working with healthcare institutions. And then we also took a moment just to remember Nikolai Ermin, who has been really important for our region and for the work globally as well. Thank you.
Thank you so much, Lena. And yes, absolutely. Definitely feel very honored that he was able to carve a path for all of us. With that, I'd like to maybe invite Pancho and Douglas to share their reflections from Latin America.
Hola, Apta. Bueno, comentarte que en el caso de América Latina, bueno, estuvimos dialogando con 18 personas de toda América Latina y prácticamente de estos puntos de acción en que hemos avanzado en nuestro país, prácticamente el cuidado ha estado centrado siempre en las madres. Hay algunos países donde se han desarrollado algunas iniciativas vinculadas a licencias de paternidades, pero como ya Gary lo mencionaba, de 3 a 5 días la licencia de paternidades, que no es un tiempo suficiente para poder involucrar a los hombres sobre la corresponsabilidad. En los países de América Latina se está avanzando alrededor de centrarnos en diseño de políticas públicas para poder incluir a los hombres en la corresponsabilidad, vincularlos en hacer reformas en las políticas de niñez, adolescencia. Se está desarrollando algunas iniciativas con el sistema de salud para poder vincular acciones de los cuidados, pero también de la salud masculina, de los hombres, de los padres. Se han desarrollado diversas experiencias con algunas instituciones vinculadas a ampliar la licencia de paternidades, pero también desarrollar otras acciones vinculadas a transformar las currículas educativas en los países, pero digamos que también se ha instalado la importancia en la agenda pública del trabajo, de la corresponsabilidad de los cuidados. En algunos países hay algunas licencias sobre el parto humanizado para poder involucrar a los hombres desde el cuidado prenatal, postnatal y el nacimiento de los hijos. Hablamos también en qué cosas se puede avanzar. Todavía se puede avanzar en seguir ampliando estas licencias a mayor día, no solamente centradas en las madres, como también poder desarrollar acciones en el sistema de salud para disminuir las barreras del acceso de los padres a estos sistemas vinculados al nacimiento de los hijos, las vacunas, el acompañamiento, trabajar o ampliar las currículas educativas sobre la corresponsabilidad del trabajo de los cuidados, poder diseñar instrumentos, la encuesta sobre el estudio del tiempo de los padres y al mismo tiempo cómo poder generar en las políticas públicas un mayor debate sobre la importancia de incluir a los hombres en las políticas de paternidad y cuidado. Gracias.
Gracias a ustedes. Thank you all. And with that, those wonderful words, I'll pass it now to, last but certainly not least, Anthony and Jessica to talk a little bit about what the conversations that were occurring in their room.
All right, thank you so much. Yeah, we were in charge of the MENA room, and we had a number of great discussions with the people who were with us, with some quite concise recommendations. First was to really work on public school curriculum, and they felt that was a big primary preventative type of technique that we should have the schools talk about this more. I think that can be expanded to parent-teacher associations and ways that we can engage fathers and parents through the school. There was also kind of a focus on using international days, such as International Child's Day or the 16 Days of Activism, to talk about the importance of engaging fathers and working on fatherhood on the structural levels, parental leaves, etc. Really using the cultural sensitivities around the nuclear family and how important that is in our region to kind of bring out the necessity for men to become more involved as fathers. More research, and I brought to the table a little bit of the question of conflict and militarized masculinities and how much they might interfere with structural approaches to our work on fatherhood on the systemic level. And there was a lot of focus on how we can learn from other post-conflict societies, such as Rwanda, who have been highly successful, and really network and connect and see how we can make those changes as they did on the structural level. And that it is kind of using that ecological approach. We need to push ministries and governments to really come up with policies to endorse fatherhood, as well as increasing the buy-in on the ground. And that was a bit of the recommendations we came up with. And thank you for everyone in our group for
that.
Thank you,
Anthony.
Apta.
Thank you so much. Thank you to everyone who was able to share. I think I got to all the groups. And with that, I'll pass it to Gary to close us off. Thank you once again for all your participation and for joining us in this launch.
Very briefly, because I know we've gone over time, but thanks for these important reflections. These 7 recommendations will only have life, with the strength that we have as the Men Care Network and partnering with the feminist allies who have made this work possible. And I want to reinforce something that Zara said at the beginning, that this work builds on the feminist agenda of reimagining care and centering care in our lives. Many of you know that Men Care turns 10 years, and one of our participants reminded us of that. We look forward at some time in the near future to having even longer engagement about how we take these 7 recommendations and more into our national level advocacy and programming. We're excited about the opportunities, and we see this as just the beginning of those conversations. I do want to give a couple of thanks and shout out. This was a collective labor, both Men Care as a cause and the report itself and the thinking about what should go into the recommendations to really move ahead on this. I want to thank again the co-authors of the report, Apta, Brian, Rachel, Nikki, thanks so much for all your dedication and time to it. I want to give another shout out as well to APTA and IMPO as coordinators of MenCare. Thank you for all the support you do, all the engagement, all the nudging us to keep this campaign focused on its cause, and for keeping us all together at the table, and for organizing this session. I also want to give a shout out to Alexa Hasink. I think if you've been involved in MenCare over the past 10 years, you have met Alexa at some point. She has been Promundo's Director of Communications for much of the last 8 years, and has been a true asset. Sadly, Alexa is leaving us for another opportunity, but I just wanted to give a shout out and a big thanks, Alexa, for all that you've done for MenCare and for the State of the World's Fathers report. Reports, plural, you have helped get them into the world and get them seen and read, and we're very grateful for that. And with that, we consider the conversation open. We get to share this as well at the Generation Equality Forum, and we expect and hope for lots more conversations. We will have summaries coming out in Spanish and French shortly, and we hope to engage with our partners in different parts of the world on it. And MenCare is really the strength of all the work that all of you do. And so, thrilled you continue to encourage us. We have been exhausted by what Zoom life has meant, but we felt empowered and engaged by all the energy that you all bring to this. Thanks for staying to the end. Thanks again to our speakers for all those important comments. And we look forward to continuing this conversation. I want to turn it back over to Bianca for some final comments. The Ubuntu call to action and platform has been the home for where we take this intersectional, feminist-driven platform on care equality, and encourage all of you to participate in the closing event with the MenEngage Ubuntu Symposium next week. Bianca, big thanks to you as well, and over to you.
Great. Thanks, everyone, and thank you for a great session. Thank you to all the participants, and we hope to see you online again soon. Take care, everyone. Bye.
Bye. Thank you.
Bye, everyone.
Thanks, everyone.
Bye-bye. Thank you.
Welcome, Sub-Saharan Africa. I'm excited to, have all of you here. I'm not sure whether we have any French speaking or Spanish, I'm not sure, but then the interpretation is available. So this is really a discussion after what we've heard from the panelists who have spoken, and so I have several questions that I'm hoping that we can get a bit of time to discuss. So the first one really being about, so we've had the 7 action points that Gary took us through, and I wanted to hear for us as Sub-Saharan Africa, which one do you feel has the greatest momentum for us to achieve? And are there any things from the models provided that we as the region can try and adopt? So that's my first question that I want to hear from anyone. Yes, Christine.
Yeah, thank you very much for giving me this opportunity. Greetings from Rwanda. I'm thinking that about the action which it could be much easier for us to start with. In the Rwandan context, I'm thinking about the first action, about putting in place policies, because we are already doing a lot of work with government. I'm talking about the work done by Save the Children International Rwanda Country Office, and I'm thinking it could be much easier for us to continue to advocate for the gender-sensitive policies in Rwanda. Thank you.
Thank you so much for that insight. We saw quite a number of interventions that Rwanda is doing. I'm very excited and motivated, honestly. Any other person who'd like to share their thoughts. What was that one key action they are there on the screen that you feel, you know, they stood out for you, and you think that, well, as sub-Saharan Africa, we can really try and adopt some of these recommendations. So Alexa has helped me with the questions. It's on the chat. Yes, Claire, you can go ahead.
Thank you very much. It was a great presentation and an interesting discussion. Speaking from Uganda, I would think putting a focus on expanding social protection programs, that area would be, because we already have existing social protection programs, so it would be more of rethinking and refocusing these in terms of the target, in terms of expanding the scope, because I'm not very familiar with the programs in the other countries, but here we mostly focus on not even all women, okay, women, but not all women, and then children. At some point, it was vulnerable children, and then the disabled. But being able, and yet it's the same ministry that handles the whole social protection component. So being able to expand the scope and rethink, take into account some of this evidence, the emerging evidence. The COVID situation has also showed us that we need to rethink our social protection programs, because if they are not able to withstand crises like the COVID pandemic, then something else needs to be done. So I think that's a critical area, and it's one that is doable, because there's an opportunity that the programs are already existing, and we have new evidence that can move or can fast track the actions towards rethinking and reshaping the programs. Thank you.
Thank you so much, Claire. And if I may try and break a bit, Uganda is also going to be launching the State of Uganda. It's a scoping review of the State of Uganda Fathers Report next week. So it's quite exciting that, you know, some of these action points that are mentioned in the State of the World, Uganda also does touch, the report in Uganda also touches a bit on that. And I know we have a bit of limited time, so I will try and rush a bit through the questions. But again, like Apta said, this is the first, I think this is one of the first times ever as the sub-Saharan continent, where we as MenCare partners or colleagues get to meet and talk. So this is a first step, and I'm hoping that if we don't go through all the ideas and everything, we can always reschedule another time where we can get more time and speak about these issues. So for the second question, really, I'd like to know if, out of the actions, the 7 actions, were there any that you felt, well, they are not really a priority, for our region? I know we've spoken earlier about the ones that we felt they are the most ideal, but now I wanted to just hear if you feel there are some that you think, no, they're not really our priority here. And also, why would you say they are not really a priority? I am not seeing any hands, so I'm assuming that if no one is raising their hand or saying anything. Oh, okay. Thank you, Maria. You're saying that you find all of them important and applicable to our region. That's exciting to know. And I'm sure the silence also echoes everyone in the room. I'm assuming that we may all feel that all the 7 action points are indeed important. So what do we do now? Where do we want to go? Now that we have these 7 actions, what next? So it's a discussion that I want us, to have a bit of discussion, like where do we go next? So we now have an idea of the national care systems and policies. We've discussed about the change workspace conditions, parental leave. We've spoken really a lot. So for me right now, what next? What do we do? I've also noted the comments in the chat. So if there's anyone who wants to share where to from here. Kawinzi, you can go ahead.
Hello, I am Kawins Moyo from WP. I just wanted to say, going forward, I see in our region is so important really to emphasize action number 7 about men, politicians. Not only that, if we involve them, they can set a good example for other men to follow, because we know that men like to follow other men. So I will see this is, for me, is really important action point. How do we move forward with this one? Over and back to you. Thank you.
Thank you so much, Kawinzi. That's quite an important one, and I'm sure with the many policymakers that we do work with in our various projects or activities, this is something that is quite easy for us to do. We've created a lot of relations really with policymakers, so something that Southern Africa we can do, Sub-Saharan Africa, sorry. I can see Christine, is this on previous hand?
Hello.
Hi, Christine.
Yeah, it was a previous hand, but as I am given another chance, I'm thinking the next step will be just to ensure that the report is disseminated at the country level among our key partners, so that we can strategize together on where to start and move forward with the implementation of all these actions and recommendations. Thank you.
Thank you. That's another great idea, really. I mean, we have the document now, and the next step, honestly, would be to share with other colleagues who are not in this meeting, because there's quite a lot of ideas that we can start somewhere as the Sub-Saharan region. So I'm going to read a few comments from Nakai. He says Zimbabwe, it is critical to engage on the equitable parental leave. We still have females only going on leave in Southern Africa, but this is an opportunity for regional program. And he says that all of the actions are quite critical. And I'm sure it echoes quite a lot of countries really in Sub-Saharan Africa where we still have parental leave, I mean, paternity leave for men, which is still 3 days. I mean, if you compare with Europe, Sweden, for example, there is quite a large gap. So what do we do really as the region to try and catch up and, you know, bridge the gap that is there? Christine, you also said all are important. Fidel Romrek, nice to see that you're here. He says they are not all applicable in our countries because in some countries, some of those actions are not easy to implement. I don't know, Fidel, whether you want to share a bit on this point. Is Fidel still here? Okay, I don't seem to see him. Anyway, moving along, I'm reading comments. Benny says the male care. Not so sure which of, maybe the male politicians. Claire also says all they are critical and complement each other. I agree. Maria says action 4, it's challenging the informal sector. Which is true. I mean, you look at how Africa, I mean, we are having a session with MenEngage Africa partners in Kenya right now at the moment. And one of the key issues that we were discussing is that, you know, in Africa, our forms of employment is quite informal. It's not so formal. So how do we then get discussions around on how do we, you know, put policies for parenting on the informal sector? So if a father is selling vegetables or if he's hustling, doing another job that is not really a formal job, so what do we do? I mean, this is the situation that we are facing in Africa. So thank you for that, Maria. Bernice says not women and girls, which is more important for us. And then Nontombi, agreeing with the speaker. Thank you. Moving forward, Claire says we have the evidence taking collective multisectoral advocacy in our different countries. So I'm excited that at least we have a bit of a way forward to say where do we go. At least I think we do have some ideas and starting points of what we can start doing. So my other question is, what are you lacking in your different countries in order to be efficient in the work, in the care work that you're speaking about at the moment? So what are some of the things that you think you are lacking? I know finances are usually the first to come out, but I would love to hear some other, challenges that we are facing that hinder us really from, doing all these action points. Nontombi, you can go ahead.
Actually, my response was targeted to the previous question, but even with this one, I think this boils down to the ethic of MenEngage, cultivating that culture of the ethic, or yes, the value of ethic of MenEngage, because that will speak to different action plans and also different sectors. I mean, when you look at in our African context, we have quite a very, how can I put it, to some extent, a toxic way of viewing manhood. And if we start by cultivating that, teaching men about the importance of caring, or teaching young boys about the importance of caring, that will also speak to the workplace. That will also speak to also the issue of transforming healthcare systems. And also, it is one thing to have parental leave, but how is it received or perceived? Do men really want to also take parental leave? Is it also stigmatized in the context that you are being like a woman? Why would you want to take leave to look after a newborn child? So I think it is important that for me, the action plan number 5 speaks to all of this, whereby we are promoting an ethic of MenEngage. And the challenge can also be the issue of capacity, like having people who are championing for the ethic of MenEngage, apart from finances. Also, finances requires champions, people who will be advocating for this kind of work. So thank you.
Thank you so much for that reflection. Quite important points that you touched on. I'm going to give it to Claire.
Thank you. I wanted to respond to the question on what is lacking. I see here, before this report, what we found lacking, and even from our report that we are going to launch next week, is the actual evidence on what works and what has worked elsewhere. We did not come across a lot of evidence from Uganda, and yet we need that evidence to inform policies and further action. So the evidence on what works, and then coordination among stakeholders, because there are so many points of intersection with this work and what other people are doing, what the feminist movement is doing, finding those points of intersection and being able to have a concerted effort around the issue of promoting male care. And then most importantly, the issue of social norms. Social norms still are still central to this whole issue. So finding a way around challenging the social norms effectively, and being able to achieve those changes in the mind, the shifts in the mind, starting with the leadership, and even at community level, at all levels, being able, that capacity to be able to challenge those is what is lacking, and what we can ably work on.
Yeah. Thank you, Claire. I agree. You know, working with you on the Uganda report, I think the major thing was evidence. Who has done this work before? But again, on the flip side, I'm also excited that at least we have a starting point through this report that we are going to be launching in Uganda next week. So it's true. I'm noting you, Kawinzi.
Okay, thank you so much. This is really an issue of importance. I'm the director for Gender at World Food Program. So I think also focusing on social norms and care of men, we also really need to look at what women think. Because sometimes women think it is not the men who need to do some work. So here we must really work on both men and women to change their mindset on what they think about being a man and being a woman. Otherwise, we'll miss a step if we focus on men. But we need to make them change their mind in what is taken in African context to be a man or to be a woman. So for me, this is important. Back to you. Thank you.
Thank you so much for that contribution. I really appreciate the feedback that you are giving. I'm also going to read some of the chats. Maria says capacity to undertake mindset change, especially in traditional norms. I agree. So, you know, yeah, if I start talking, I won't finish, especially when it goes to the traditional and religious social norms that we have in Africa. It's another area where I really think as this region, we have so much potential to engage our traditional and religious leaders, you know, to try and see where we fit these actions to, you know, create that care equality in our region. Katie, thank you so much for joining us. By default, we adopt you in Africa. You say you try to join the North American and Asia group, but the button froze. But you'd like to say we lack a feminist movement that prioritizes the issue and speaks loudly about this movement. That was interesting from the Uruguay case, and this issue was brought forth from grassroots feminist movements, but this is missing in my context. Thank you. I agree, opening the eyes of both men and women. Thank you for sharing this reflection. And one thing, you know, when you share this session, this reflection, we may be from different parts of the world, but we kind of link somewhere. So thank you for the feminist opinion, feminism movement. That is a really important session. Apologies, I'm speaking very fast because I'm hoping that we manage to go through all the sets of questions. And then Monique says that is indeed important to think about what is it to be a man or woman. So as to change norms, we have to focus on the benefits for both men and women. Thank you so much for these comments. And I think number 5, the 5th question is somehow partly answered because it's who are the partners or allies and who are our targets. I think Katie did mention the feminist movement. Someone also spoke about the religious and traditional leaders. Not so sure who else are our allies in this work that you think we need to, you know, work with in order for us to achieve these 7 actions. So you can type, you can raise your hand. Okay, Maria says, great to hear what unites us in this time of divisions. Indeed. And you also say men and women. Indeed. We need each other, honestly, for us to, you know, achieve gender equality, care equality. We really need each other as men and women, girls, boys, everyone. Anyone else who wants to share? Who else do we want to partner with? Who do we want to work with? Who are our partners or allies? So Danya says men role models in all institutions, communities, and so on. So role models are powerful for affecting and instigating change. Yes, I think someone did also mention it earlier on. to say we need positive male role models, which is something I think we really lack in our communities. I know we've done quite a number of, campaigns as Sonke where we champion men as, the positive role models in our communities. So thank you for that reflection. Vessel says we need support from AU for progressive positions. Indeed, working with our policymakers, because they are the ones that who channel us and give us a lot of, okay. So I see that our time is up, Africa. So I will hand over to Apta, but just to say thank you so much, Sub-Saharan Africa. It's been nice. This is just the beginning again, and I'm hoping that we will get another chance to regroup and continue these discussions. So thank you so much.
La acción 2, licencia parental remunerada y equitativa, no transferible. La acción 3, vinculada a ampliar los programas de protección social. Acción 4, la transformación de los sistemas de salud. La acción 5, promover una ética del cuidado masculino. Acción 6, cambiar las condiciones del lugar del trabajo. La acción 7 está vinculada a la rendición de cuentas a los políticos hombres. Esto es parte de los 7 puntos de acción vinculados en este informe de paternidades. Y quisiéramos iniciar, les hemos compartido este Jamboard en el chat para que podamos ingresar, y queremos iniciar con esta primera pregunta sobre estos 7 puntos de acción que se plantean en el informe. ¿En qué hemos avanzado como país desde nuestras propias realidades en nuestros países, regiones? Entonces, nos gustaría invitarles a que puedan escribir en el Jamboard en qué hemos avanzado sobre paternidad y cuidado en nuestros países.
Encuentran el link ahí en el chat. Nos avisan si tienen todo acceso. Entonces estamos mirando en el punto 1, ¿no? Que está en la segunda página del Jamboard.
Sí, veo que ingresaron 10 personas por acá.
Se pide que que se dé acceso a la edición para poder escribir.
Te la doy ahora mismo. A ver si le cambiamos el seteo. ¿A todos les pasa lo mismo?
Sí, igual a mí, Francisco.
Ya, vamos a ver acá si podemos corregir el seteo.
Yo puedo acceder, Pancho.
Ya, denme un segundo. Acá está. Ahora sí lo actualizamos a editores. Ahora todos deberían poder. Pedimos disculpas por este imprevisto tecnológico. Ahora sí quedaron todos como editores. Me confirman, por favor.
Ahora sí, ahora se puede.
Ya.
Ok, bien. Perfecto.
¿Podrían agregarle el país quizás al comienzo o al final para que tengamos una idea de qué país se trata? Bueno, vuelvo de inmediato, que voy a conectar ahí a clases a mi hijo pequeño.
Ok, adelante.
Bien, son las acciones de paternidad en casa, la política doméstica.
Directa. Bueno, como solo tenemos 30 minutos, propongo si avanzamos a la segunda, por favor, que está centrada en qué punto podríamos avanzar en nuestro país y hacia dónde queremos ir, basada en las experiencias que hemos desarrollado, en las otras acciones o iniciativas que nos falta desarrollar. ¿En qué punto podríamos avanzar o estamos avanzando en nuestro país o en base a las iniciativas donde estamos vinculados o vinculadas?
Douglas, quizás después de llenar este segundo nos podemos detener para dialogar un rato.
Sí, así es, colega.
Perfecto. Ahí se mencionaron en el primero licencia de paternidad en Colombia de 8 días, de 5 días en Chile, en Ecuador que se está en un proceso de reforma del Código de la Niñez y la Adolescencia, en Uruguay que tiene un sistema integrado de cuidados, en Nicaragua que hay una normativa de parto humanizado con 5 días de licencia de paternidad. En Argentina dice se han comenzado a dar pasos como la creación de un área de cuidado. En México dice solo se ha avanzado en el diseño, presentación y distribución de la agenda Suma por la igualdad, donde hay un énfasis en la corresponsabilidad. En Brasil 5 días que pueden llegar a 20 para los trabajadores vinculados a la red de empresas Ciudadá. Eso en el caso del punto 1, ¿no? De en qué hemos avanzado.
En el punto 2, ¿en qué punto podríamos avanzar nuestro país? Dice en Uruguay, sostenimiento y fortalecimiento de acuerdos y trabajo interinstitucional. En República Dominicana hay la necesidad de reformar el marco legislativo, en particular la ley de trabajo, para asegurar la posibilidad de cuidado equitativo. En Nicaragua dice ampliación de la licencia de paternidad que trabaja articuladamente el sector salud, educación, procuraduría, sobre la importancia de los cuidados. Igual número de días para licencia de maternidad y paternidad remunerada, que sea un rol compartido del cuidado neonato. En Uruguay, mayor debate en la legislación por tenencia compartida. En Chile, ampliación de licencia postnatal para los padres. En Bolivia, visibilizar el trabajo de cuidado a través de estudios y encuestas de tiempo es ausente. En México, Cómplices por la Equidad está haciendo un esfuerzo por participar de un sistema nacional de cuidado y queremos conocer un poco más de otras experiencias. En Argentina hay que ampliar licencia para padres, varones, aún solamente hay 2 días. En Chile dice hacia un postnatal masculino exclusivo y hacia una cultura de la corresponsabilidad y mejores políticas de balance de trabajo y familia. Ok, eso es lo que tenemos con relación en qué podríamos avanzar en nuestros países. Está por acá, en acceso a servicios de salud en relación a las paternidades, en servicio de salud, licencia parental para mejorar la participación de los hombres en los procesos reproductivos de las mujeres.
Bien, ¿te parece si abrimos la palabra, Douglas, para
Sí,
comentar?
ok, perfecto. Así que abrimos por acá los micrófonos para las personas que quisieran compartir alrededor de en qué estamos avanzando en nuestros países y hacia dónde nos gustaría seguir avanzando y a dónde queremos ir. Adelante, los micrófonos abiertos, por favor. Así que el grupo, quienes quieran compartir, por favor, el micrófono está abierto.
Amplío un poco más, amplío sobre México. Hay una experiencia que sería interesante que se conociera más, que tiene que ver con que las licencias de paternidad sean algo que no se otorguen meramente porque sí, sino que quienes a los hombres se les invite a tomar un entrenamiento, un curso, un taller para el uso de la licencia de paternidad y que de esa manera realmente queden vinculados al proceso de la licencia.
Gracias, Hugo, por ampliar más información sobre México. ¿Alguien más del grupo que quisiera ampliar más información sobre lo que hemos puesto aquí en esta pizarra?
Hola. En Brasil también, como habla Hugo, hay que, para se extender estos días de licencia de paternidad, ya hay un curso, algo que hay que hacerlo, pero es como un campo un poco obscuro porque la legislación no es clara, ¿no? Que de verdad, qué curso es el que corresponde a esta atención especial a los hombres antes de sacar la licencia extendida.
Gracias, Norma. Bueno, también compartirles que en el caso de Nicaragua tenemos un parto humanizado donde los hombres pueden asistir al sistema de salud. En los últimos 2, 3, 4 años estuvimos trabajando con el Ministerio de Salud para poder hacer mayor propaganda, pero debido a los contextos sociales y la crisis social política en Nicaragua, este proceso ha cambiado. Ya los hombres no pueden entrar a los sistemas de salud para el nacimiento de su hijo, y otra de las cosas también es que tenemos pocos datos alrededor de el uso de esos 5 días que tienen los hombres sobre licencia de paternidades. No hay una estadística si realmente la están utilizando o no. Y la otra cosa es el poco cumplimiento de las empresas privadas para otorgarle el permiso pagado a los hombres en estos 5 días.
Buenos días. Precisamente por eso comentaba, en el caso de República Dominicana, creo que el tema importante es cómo modificar la legislación, porque como queda para que cada quien no dé lo que le parezca a partir de esos 3 días, pues es un poco complejo. Entonces, cómo demandar cierto nivel de responsabilidad cuando las condiciones legislativas no te ofrecen una oportunidad adecuada, digamos. Entonces, por el otro lado, las empresas privadas, algunas están haciendo esfuerzos interesantes. Hay alguna que incluso llegó a proveer licencia equitativa posparto, pero es una, ¿no? Entonces, estamos trabajando, sí, para dar visibilidad a esas empresas que han aumentado a 2 semanas, a 3 semanas, a 3 meses, como es el caso de ese en particular, pero siguen siendo casos aislados porque, como decía, la legislación lo que pide son 3 días. Entonces, más allá de eso, ninguna empresa está obligada, ¿no?, a hacer más que eso.
Gracias, colega. ¿Alguien más del grupo quisiera compartir o ampliar mayor información? Estefanía.
Sí, en relación a lo que vienen hablando sobre las licencias paternales, acá en Uruguay, bueno, desde la legislación también son 5 días completos, con paga completa. Lo que se logró en los últimos años fue que una vez que se termina estos días para el padre o los días para la madre o el padre, todavía no hemos logrado que puedan ser los dos o algo así, puedan elegir seguir trabajando en medio horario por 6 meses más, y el Banco de Previsión Social les paga, digamos, esa mitad de horas que no estarían trabajando. Por ahora, en ese sentido es.
Gracias, Estefanía. Así que nos van a cerrar en un par de minutos la sala. Bueno, comentarles que, bueno, la idea de este panel, de este espacio era para poder compartir en qué hemos avanzado en nuestros países, hacia dónde nos gustaría avanzar. Luego teníamos otras preguntas, qué otras medidas o acciones nos gustaría seguir implementando en nuestros países o estamos vinculados a estas iniciativas que anteriormente hemos compartido. Luego teníamos otra que está vinculada.
Hello, Bafana, Sinead. How are you? Can you hear me?
Yes, I can hear you. How are you?
Yeah. Great. There's Jessica. Hi, Bafana. So it's just the 3 of us. So we'll wait to see if we have any other people. Otherwise, we can talk about the Middle East, or they can record us catching up with one another.
I was just told to come so I can record the breakout room. I don't really know anything about the Middle East, but maybe you can talk about the Middle East and I can
listen. If you'd like to hear about it, sure. Brian, there we go. We're all
surprise. Surprise.
You seen Jessica?
I do. Hi, Jessica.
We were talking about you just the other day in the office, and we were talking about what a great person you were.
Wow.
And how like just genuine you were, and how you're always listening, and how you're such a pleasure to work with.
I didn't agree.
Everyone was just like, Lada, you're lying. And this guy's from where? No, you guys are lying. Sorry, man, I just had to tell you.
No, I appreciate that. And obviously the feeling is mutual, and it's like fun to be here with you. Good morning from Wisconsin. I'm actually home with my family, Anthony, not too far from where you grew up. And But
Nice,
excited
yes.
about the happening this morning, and I very eagerly volunteered to be here and take notes if needed in the MENA room, or just give the co-authors perspective, I guess.
Great.
Yeah, I miss you guys.
And congratulations on the report.
Thanks.
Congratulations on the report, my friend.
Thank you so much.
All right. So we're not many people in the room at this point, so we can wait a bit more. But Francois and Homay, I would love it if perhaps while we have this time, you could introduce.
I'm called Francoise. Francoise Mukiza, I'm Rwandese, and I'm based in Arusha now. I'm a member of Parliament, East African Legislative Assembly, interested in MenEngage, and advocate for gender equality.
It is a pleasure that you are here with us in the Middle East and Africa, North Africa room. Thank you so much for joining us.
Thank you very much.
The pleasure is all mine. And Homay, I don't know if I'm saying your name correctly. I am going to share in the chat a link for a Jamboard. We felt I will also share this, if I can share my screen, I believe I can, just to kind of set up the beginning of our conversation. And really, the whole point of this breakout room is to ask all of you. My name is, I should probably begin with that. Sorry, my name is Anthony Gade. Jessica.
Hello everyone, my name is Jessica, and I'm a program officer at Abad.
Right, I'm the Masculinities Technical Advisor at Abad, organization based in Lebanon. And we've been kindly asked by our colleagues and partners from Promundo to kind of facilitate this breakout session. And so let me share. First, I would like to share a PowerPoint that, I don't need to share sound, that we have, just to kind of set the tone for our conversation. So here are the 7 main points that were brought out, and we're lucky enough to also have Brian Hillman with us in the room. We have a number of great people. I'm so sorry if I'm Bafana, Sinead, everyone. You're all wonderful. Brian was a co-author on the State of the World Fathers report that we're going over today. And these are the 7 action points that were really brought up about the study. And please correct me, Brian, if I'm misusing terminology. And so we just wanted to have this here to remind everyone of those 7 main action points, and to really ask everyone which of the 7 action points really stands out to you in terms of places where we could focus more in the Middle East and North Africa, places where perhaps this action point has cultural sensitivities or there are problems with engaging in this strategy that might entail following up on these action points, and really anything that comes to your mind in terms of how do these action points relate to the overall cause of promoting equitable masculinities and care-oriented masculinities in the Middle East and North African region. So I will also share, these are the questions that we have for everyone. If we'd like to take a moment of those, I'll read them out loud. Number 1, of the 7 action points, which is the most feasible, or is there the greatest momentum or achievement? Which are the things that models can provide and be adapted best for the region and our efforts? Of the action points, the ones that we haven't mentioned, why might they not be priorities? Especially talking from the regional perspective of Middle East and North Africa, here, not in the global sense. Based on our first answer, which are the action points that really stand out and we can maybe make the most impact? Where are we now in achieving this particular goal towards that action point, and where do we? What are the hopes that we have for achieving that action point? What are we lacking in order to be efficient in the work we do? I imagine this goes beyond the action point, but always relating, kind of taking the action point as an end goal. What do we need in terms of resources, enabling environment, personnel, etc.? What needs to change politically, whether that be globally or locally? Who are our partners? Who are our partners and our allies in achieving our targets, and who are the people we'd like to speak to? What are key moments or significant events that can be important for us to really catapult our way forward in working towards those action points. And finally, what are some short-term and long-term activities that we can do both individually and as individuals and collectively, really looking at that public health, ecological perspective. And I'm speaking English right now because, to the best of my knowledge, in the small group that we have, there are no Arabic speakers. I could be making an assumption that's wrong, but if anyone would like us to speak in Arabic, please let us know. Jessica and I are fluent, some of us more fluent, in Arabic, and we'd be happy to also do our best to provide translation for those in the room. So these are the questions. Perhaps now, if it's all right with everyone, I can stop sharing that, but I can definitely pull that back up if need be. And now perhaps, hopefully everyone has opened the Jamboard. So now I can share that as a screen. And obviously up here, we can shift through the 7 questions that were asked. And please don't wait for us. We are recording. We would love open, transparent dialogue. We would love to listen more than we speak, especially in taking your perspectives. But also we understand everyone learns and interacts differently. So we would also really appreciate it if you have thoughts on these questions, to not wait for us simply to enter that into the Jamboard, and we can all see it here, or just really collect your thoughts for when we come back to the matrix group. I'll stop talking now. Jessica, do you have anything to add?
No.
Okay. So we want to really give this space for everyone else in the room. Please, anyone who has ideas or a thought or would like to say anything, we would love to hear from you.
Hi, if I may speak, I am actually using my phone, so my screen is very small. I'm actually joining from the Maldives, which is in South Asia. So I understand this is the MENA region group, but I guess Asia is not big in this report. I think from the Maldives perspective, I would highlight the importance of changes to the public school curriculum, which actually have a lot of stereotypes on, and actually reinforces gender inequality. So that is a fundamental problem we have that actually needs addressing. I'm not sure how it is in the MENA region, but this actually is one of the sticking points that has a huge impact on the lives of men and boys because of this early education that is so skewed. So I just wanted to share that with you. Thank you.
Thank you so much for joining us. It's a pleasure to have you with us. I don't know, Brian, you do know if there is a parts of reports that do relate more to Asia, because as much as I would hate to lose one of our colleagues in the room, if there is maybe a room where the feedback would be more pertinent, I don't know if you mind weighing in, or Sinead, or anyone who is better known.
No, I think you're right that there's not exactly an Asia organizing committee for MenEngage at the moment. There's a strong South Asia group, but I don't think any of those leaders are here in the room right now. So you're kind of just welcome to join anywhere and share your perspective. And it's in some ways also like useful just to hear expertise from other regions to help inform Anthony and Jessica and colleagues in Southwest Asia, North Africa to guide their work. But I'm sorry if you feel a little bit like the refugee of the space.
Well, then they would be in the right region if it was the Middle East. So,
do we raise our hands or we just talk?
No, please, Francois.
Thank you very much. Yeah, I'm happy to be with you in this room. As far as the first question is concerned, what are the key moments? When we talk of the key moments, we should think of these international days that involve both men and women. For instance, at EAC level, East African Community, every year we celebrate International Women's Day. And we encourage even all the members of parliament those willing, of course, because it's a journey of transformation, to join women for International Women's Day celebration. And it is done at the regional level and also in partner states, because the community is composed of 6 partner states. And I have been part of this journey since I joined the parliament. This is my 4th year now as a parliamentarian, and I'm committed to really bring on board men, parliamentarians, politicians, to be also responsible in this journey of transformation. They are the ones to be transformed, but also women. We have discovered that some women also need to change. So as far as events are concerned also, we should also recall some declarations, such as Beijing Declaration, such as CEDAW. Those are the kind of laws we have to record as events, so that we can tell men that as we are trying to engage you in this journey of transformation, it is the right of women, first of all. And then you are our brothers, you are our husbands, you are our uncles, you are our friends. So it's very easier if you understand these things for the mobilization. And we should do work together. For instance, in the assembly, we do work together because now they have become to know that there is nothing to hide each other, because we live as a family. I think it is a journey I started to advocate for. And in the last, my last life, I worked with the Promondo US. I have been a staff of Promondo under Men Care Campaign, a global fatherhood. And this is the background I'm having, and I picked interest from there to continue to advocate for the change, because these cultural norms we are having, especially in Africa, it's very hard to change them if we don't work as a team. And I also decided to deepen my research together with WAMREC. WAMREC, I have been a staff of WAMREC, but now I'm willing to compare the work of WAMREC and the work of MenEngage Alliance in Tanzania. So I'm going to do this under a PhD research. Maybe what I can ask, because I'm combining those questions together, is that what can help me really to have, that successful? Because when I read through the existing documents at the Open University of Tanzania, Dar es Salaam, there is no research in terms of MenEngage. It is zero. So I have no documents, and just reading from Promundo, from your work, from this Ubuntu Symposium. That's why I'm interested to be with you, so that I can have, information and then influence the East African community. Thank you very much.
Thank you so much, Francoise. You said so many important things, as did Hamé. I'm sorry, in light of hoping that other people could speak up, Hamé, definitely the thing you said about curriculum in schools is also very relevant in terms of Lebanon. With even a lot of our school curriculum, the way they reference the Lebanese civil war and conflict is even antagonistic towards our achievements towards gender equality. And Francoise, excellent points made in terms of maybe how we can capitalize more on international days, such as International Women's Day, the 16 days of activism. This has been a successful strategy thus far, but perhaps maybe we could find maybe a few of these days, like International Children's Day, to really focus on fatherhood as an issue, and really use that to catapult more of the issues. You also gave some messages about personalizing it. Men are the fathers and the brothers and the friends. And that has been a strategy that has been brought up in the Middle East, especially since the nuclear family is held in a high priority in terms of that's part of our culture, that the family and the nuclear family. So maybe framing fatherhood and the importance of these issues, from paternity leave all the way to the micro of men taking on more care work at home, is best placed in that way. And I also heard you call for or refer to your work with Ramrik and the ministries and how successful that was, which probably could be applied here, as well as more research. What was that? Did I miss anything out? I know you said so many great things, but is that the gist of it? And also, anyone else in the group, please. I think we have one new person. Please feel free to share your own thoughts. Maybe we can even give a couple of our own as residents in Lebanon and the Middle East. I would prefer to hear from everyone, but if maybe there's a stall or then I could maybe pose a question and see as Brian even mentioned earlier on, there's so much similarity often between different regions that there might be some questions that I can pose to get everyone's thoughts. Does anyone have anything to add to the thoughts? And please feel free to also write in the Jamboard. I shared the link in the chat if anyone would be interested to do that. We are taking notes, we are recording, but that is also available. If you don't want to speak, you can just shift through the questions and the pages as so. So perhaps one thing that I would think of in terms of the action points, and when I first saw the action points, and how many have to do with systemic change and the importance placed on systemic change, is the fact that so much of the work of Promundo and Abad and colleagues within Masculinities and the Engaging Men Network have to do with enabling environments. And then I come back to the militarized forms of masculinity that are so heavily socialized in regions of the Middle East. The levels of conflict that exist in present-day Palestine, in Lebanon, in Syria, in Libya, in so many places around the region where we just have a backdrop of conflict and fighting and death, and really promotion of this power over dominant militarized masculine identity that filters its way down to the general population. So what are thoughts of maybe how these propose obstacles towards us achieving systemic change, especially in light of the fact that the Arab League, I've often said it as an advocacy venue for the region, they're often very unresponsive to civil society. And of course, how homogeneous our countries are. Egypt is nothing like Lebanon, it's nothing like Libya, it's nothing like Morocco. So I just maybe a couple of your thoughts. I know I threw a lot that how conflict could possibly stand as an obstacle. Maybe if someone has positive examples or have learned of ways that despite conflict, we were able to focus on issues of fatherhood or promote healthy fatherhood and equitable masculinities despite the context of conflict. Does anyone maybe have any thoughts or would like to share maybe if they have any thoughts on that or experiences towards that? Oh, yes, Hamid, please. Thank you.
I just, based on what you just explained about the, militarization and how it feeds into all these toxic masculinities, it just occurs to me that one of the successful projects that has been mentioned in the main report presentation is from Rwanda. Rwanda has a very, very, terrible history, a recent history. So if they can transform through, a program like the one that was explained, then surely there must be an entry point in some of the contexts in the MENA region also. And the thing is, when the effects of conflict and militarization happen, it doesn't necessarily spare anyone, right? So it's everybody, it's the whole families that are being affected, whether it's man or woman or child. So the fact is that everyone is in the same boat in conflict. I understand that, of course, women are deeply more disadvantaged still, so are men, you know. So I'm just thinking that perhaps the Rwanda example, maybe I would really like to learn about that. In fact, I will look at the report afterwards to learn how that has been done, to learn more about that program. I think I have actually heard about this some while back, but it will be good to read about it in this report. So I think we need to learn from those examples, perhaps. Thank you.
No, thank you so much. Thank you so much. And I don't know if Francoise has anything to say since Rwanda was.
Let me add something a little, because
sure.
The first picture, if I call it a picture or a photo you shared with us, I immediately picked that the promotion of an ethic of male care. It's very important to promote the ethic now at the level we are in. Given that this is being done at the global level, but we need to domesticate that one. Rwanda is doing well. I'm the eyewitness because I have been working with Guamurek under Promondo Men Care Campaign. But for instance, here where I am in Tanzania, it's very tough. It's a struggle. Even the issue of religions is coming in. When you start talking of, change, Muslims, for instance, they start saying, no, having 4 wives, 5, it's among the Quran, all those things. So to change those cultural religious norms, it's very difficult. That's why the second point I may also pick from what you have shared with us is this one, national care systems and policies. They are also very important, although we are working at the regional level, but still we need the national policies across, across Africa, because we are also working under African Union. We have joined. So we should start this campaign, this mobilization in terms of the whole Africa, not only Rwanda, not only, because I compare countries, I started my research, the literature review, it is really showing that nothing is being done really tangible. And if we don't engage men to change this ethic, really, we can't reach far. Remember that Gary Becker, because I know he has been my boss in the past years, I read somewhere a figure about 96% ahead. Those people, you, me, your sister, or I don't know, your friend, we won't be around. So engaging the young generation to speed up the process of engaging men for gender equality is very crucial. Thank you very much.
Thank you so much. Everyone, the breakout room will close in a little bit less than a minute. So I'd like to thank you all. And just Francois, just to cap maybe that last thing that you said. So basically you're saying sometimes that change can happen if we focus on the structures, that has effect on the cultures as much as working from a cultural perspective will have an effect on the system. Did I get that right? For the most part? You're on mute. You're on mute.
If we don't speed up the process of engaging men, starting sensitization, so that men can understand the good thing of working with women, of caring their children for their own benefits, we will delay. Because Gary has showed that 96 years ahead.
Hi, everyone.
Hi, Alina, how are you?
Hello. I'm fine. Oh, there are some cameras being turned on. Hi and welcome. Oh, there are some almost all familiar faces in this room so far. That is lovely. I wonder, Irina, are you here? No, I don't think so. Oh, here's Irina.
Oh, okay. So
Oh, that was such a challenge.
Was that such a challenge? But you made it.
I mean, I didn't know that speaker would speak in Spanish. I don't understand Spanish.
Well,
okay, I read the slides.
Welcome to you and welcome to everyone else.
So what do we do? How do we go about communication?
Yes, let's see. We just found out earlier that there will be no translation in the breakout rooms, only in the main room. So I think since we have Irina here and we know that there are people in this region that speak Russian, I wanted to ask, is there anyone present in the room that do not follow the conversation in English?
Stop, please. Теперь я скажу по-русски. Поскольку у нас здесь нет возможности синхронного перевода, вопрос Лена задает. Есть ли кто-то у нас здесь в секции, кто не понимает, недостаточно понимает английский, чтобы следовать за беседой, чтобы понимать беседу? Есть ли кто-то, кто не понимает достаточно по-английски и кому нужен перевод на русский? Поднимите руку, пожалуйста, что ли.
Do we know?
То есть мы правильно понимаем, что у нас нет участников, которым обязательно нужен перевод с английского на русский? So, Lena, I asked if anyone, absolutely needs interpretation from English into Russian, or they can follow.
Okay, so perfect.
So we don't see anyone who cannot follow English.
And which means that if anybody wants to speak and feel more comfortable using you in supporting with translation, that is perfectly fine. And I think we can all be mindful, especially that goes for me. I can be a very fast speaker. So if anyone is not following for any reason, just let us know. So again, a warm welcome. And if I may, I would like to encourage as many as possible to turn their cameras on, because this is a smaller room and it will also be slightly interactive. So if you, for any reason, want to have your camera off, of course you can. But if it's more that you have forgotten to turn it on, or is just indifferent to that, it's always nice to see each other's faces when we speak. Otherwise, I would just like to say that I am happy that you are here. My name is Lena Wallqvist, and I come from the organization Men in Sweden. And Men has been around since 1993, working to, well, engage men in the struggle for gender justice and gender equality together with people of all gender, and to work to prevent and stop men's violence against women and to others. And also, as part of that, to promote men's caregiving and gender equal parenting. And I think that I would like us to just do a quick round of saying our names and organization, since we are not too many in the room. So perhaps I can just go through the list that I have so we can see who is there. I will just ask you by your name to just introduce yourself and say who you are, if you come from an organization and what country. And from me, Irina is next on my list, so perhaps you can go, Irina.
Я Ирина Савельева, я переводчик. Я хочу сказать тем, кто говорит по-русски, I will repeat in English. Я хочу сказать тем, кто хочет представляться по-русски, вы можете представиться по-русски и просто попросить меня перевести. I am Irina Savelyeva, I'm an interpreter, and it's been my pleasure to interpret for a series of seminars organized by Men.
Thank you. Jens, you are next.
Hi, my name is Jens Karlberg. I also work for the organization Men. I work there with, as responsible for the work of gender equality in Sweden.
Thank you. And then Joni.
Hi everyone, I'm Yoni van de Sant. I work with the MenEngage Global Secretariat as one of the co-directors. I am from the Netherlands, but I'm currently based in the United States.
Alexander, are you here?
Здравствуйте, слышно меня? Да. Александр Малышев, по-русски переведите, пожалуйста. Александр Малышев, социолог проектов по отцовству Центра Анна и ассоциированный научный сотрудник Социологического института в Петербурге.
Alexander Malyshev works with Anna Anti-Violence Center in the Conscious Fatherhood program, and he also is a researcher with a research center in St. Petersburg.
Thank you. And then we have Alexander Kuklin. Are you here as well?
Yes. Hello, everybody. You hear me?
Yes, we hear you well.
I'm Alexander Kuklin. I'm from Russia. I'm a lawyer for NGOs and in field domestic violence. But now I'm in Poland, in Wrocław. I'm studying here, and I work with NGOs and with fatherhood too in Wrocław now.
Perfect, thank you. And then Chris.
Hi, everyone. I work with Promundo in the United States. Yeah, nice to be here.
And Dominic?
Hello, I am from Belgium and I work in prenatal education, trying to have both mother and father working together during the prenatal period.
Thank you. And then on my list, I have Elis.
Hello, everyone. Nice to meet you. I work at the MenEngage Europe Secretariat and part-time also at MEN. I'm based in Stockholm in Sweden.
And Maxim? Oh, you're muted, Maxim.
Здравствуйте. Я Максим, я работаю с мужчинами-обидчиками в кризисном центре помощи женщинам и уже 7 лет один из соведущих клуба для отцов, а также работаю с семьями, психолог.
I am Maxim. I am a psychologist. I work with groups of men who are domestic abusers at a crisis center for women, and I also run a group of fathers.
Thanks, Maxim. And then Sean wrote that he would be back in a few minutes. I don't know if you're back yet, Sean. Yes. No. Oh, you are.
Yes.
Hi.
Yeah, I'm back. Good afternoon. My name is Sean Cook. I am the CEO of the Men's Development Network in Ireland, and we are involved in a range of programs and work around transforming masculinities, including working with perpetrators and male victims of domestic violence. Plus, we have a health program and a range of advocacy programs as well.
Okay, thanks. And then it's Vidar.
Hello, everybody. I'm Vidar Wetterfalk from the organization Men in Sweden. I work as an international project manager here. I just picked up my kids, but now I'm home again, so I'm going to leave the car. Nice to be here.
Okay, great. Welcome, everyone. And I think what I will do is I will start screen sharing. And we can start from there. Can you all see my screen now? I think so. Does anybody not see my screen?
Yes.
Perfect. And I think that just to say something very short about this session, we only have 20 minutes. It was shortened, but there were so many interesting conversations going on. So just to say a little bit about what we are supposed to do now, we are supposed to look at the 7 action points that was introduced by Gary in the beginning of the session, the ones identified as key steps or key strategies to take the work forward in achieving a more gender equal distribution of the unpaid care work. And we are, of course, here with the European lenses on our glasses to look at what is the situation in Europe, and perhaps most importantly, where are we as organizations and actors? What are we doing and what are we identifying in terms of priorities, possible progress and challenges? And we will not get too far in 20 minutes. So this is, and Apta assured us about this on beforehand, that this is just a quick scan to get a little bit of a feeling of what the key priorities are. And then she and her colleagues within MenCare are also really happy to just follow up with individual discussions or regional or national discussions with different actors on how this work can be supported and how it can be carried out individually and collectively. I think since this is a regional workshop, I also wanted just to say that I was reading the report when I just received it. It still says do not circulate on the copy that I received. But one of the early quotes was, even in Europe, despite years of policy advances in support of equality in care work, most notably equitable paid parental leave and access to subsidized childcare, only about 1/3 of households in Europe say they share unpaid care work equally. So this is sort of where we are. Europe is a big and fairly heterogeneous region, but there are also similarities, of course. And through also MenCare and perhaps also through the MenEngage Europe network, there is possibility for joint and collective efforts if we can identify where that would be more strategic. I would, however, before we start with anything, since we are in Europe, I would like to begin perhaps with this image. And this is Nikolai, and Gary mentioned him in the beginning, and I think that almost everyone in this session has met Nikolai. And you have probably, if you have met him, you have probably worked with him, and you have absolutely positively laughed with him, because I think that is very much what you did with Nikolai. You did work, but always with a laugh, very close. And I just want to take some time here just to remind us all of Nikolai and his contribution to the field of work in Russia, of course, but also in our region in Europe and globally. And I think that the contribution that he made, of course, not on his own, but together with many, and some of you are here today, but through his contribution, I would say that that was very much pioneering and powerful work. And the way, at least I personally knew Nikolai, was that a very striking characteristic for him was that he always looked for the opportunities in everything. And I think that he was a master of networking, and he had this warm smile and the energy and creativity that made you want to do things together with him, whatever that was. And I think that he more or less completely ignored, I was about to say he didn't give a shit about, but I'm not supposed to say that. But he didn't care about barriers, I would say, whether they were political barriers or language barriers. And I think that he proved to all of us that change is possible. So I think if we don't solve everything in this regional session, if we at least can leave the session today in that spirit that individually and collectively we can actually do major things to bring this work forward. And these are the 7 action points that were highlighted by Gary. And if we would have had a little bit more time, I would have gone into them in a little bit more detail for you. But now perhaps we can just look at them like this and just, I will scan through them quickly. So the first one that has been identified is the national care systems and policies. And that is, of course, the inclusion of unpaid care work in benefits such as pensions. It's to ensure that care workers are paid the wage that sort of mirrors the importance of care work. And it is to define care to include non-traditional families as well. And then we have the paid equitable parental leave, where we also talk about job protection, of course, in that. And Parental has identified 16 weeks long at least, and to ensure that it's equal for men and women, and that there are elements or parts of that leave that is non-transferable. Then we have the expansion of social protection programs, which is largely looking at social protection elements such as cash transfers, for example, or different kinds of subsidies, and see that they sort of elevate this work. It is the transformation of the health systems. Gary highlighted some examples from Brazil, for example, in this, where it's partly about addressing the different barriers to males' involvement from the prenatal care through birth and childhood, but also to look at trainings of healthcare staff or ensuring laws and responsibility taken by health institutions. And then we have the 5th action that is much more on the gender norm transformation, the broad and wide universal work that we do together with schools, but also other arenas where we know that gender norms and ideas about whose responsibility is it to care is largely built and reinforced. So that could be schools, that could be media, that could be the gaming communities, and of course, that could be any other area where people are, and especially where young people are. And then the 6th one is to change workplace conditions and to look at flexible leave and part-time work and remote work and ensure that that is part of national workers' rights policies. And also to push for different kinds of care supportive policies on workplaces, and perhaps also role modeling by senior management in sharing the care. And the 7th one is that we hold our male political leaders accountable, not only for speaking the support, but also doing the support. And there are some proposals in this report on actually following the voting and holding not necessarily only male politicians, but also female politicians, but it has been very much women who have sort of taken the lead also in this part of gender equality efforts, and to see how are they voting, what petitions are they signing, and actually look at the actions of this. And the role then for civil society is, of course, to hold our politicians accountable for how they vote, for example, on the care agenda. So with this, I would like us all to move into the Jamboard. Have all of you ever used the Jamboard before?
Jamboard. Использовали вы когда-нибудь? Вам знакома такая вещь, как Jamboard, куда сейчас Лена нас приглашает? В чате я написала перевод вот этих вот пунктов действий. Сейчас все мы пойдем в Jamboard.
Actually, I'm starting to think. I think, Jens, maybe you are sharing the link, are you?
Yeah, I did now.
But I'm also thinking, since we only have half the time that was planned for, perhaps we skip the Jamboard to make it easier. And we just go back. I will stop screen sharing and we go back into the big room again.
Нет, Jamboard не будет, потому что у нас времени нет на него.
And I will instead see if we can do a little bit of a vote here, because one of the questions that was sent to us in our breakout rooms was, amongst the 7 action points, from you, your point of view, the work and where you are, which one do you think is the most feasible, or where you see that there is a particular I don't know, maybe a momentum for achievement.
Из этих 7 пунктов, которые я перевела примерно, в каком вы видите какую-то перспективу, какую-то возможность его продвигать?
So I will share the picture again. And if you can type in the chat, numbering from 1 to 7, which one of these, and I know that we all do holistic work and that all parts are needed, but from the work you are doing now, which one is the priority, would you say? I cannot currently see chat. So
Поставьте в чате цифру, номер
there we go.
тех действий, которые вы считаете ну,
I see number
перспективными у нас.
I see number 2 and I see number 5. I see number 5 again.
5, both for Russia.
5 from Ireland. This is like the Eurovision Song Contest now.
Прямо у нас как конкурс Евровидения, да.
3 and 5.
Жюри.
I'm saying 4. Okay, I think, so just to repeat which ones they are, number 5 is the promotion of an ethic of male care. That is the broad gender norm transformative work. I think you, Jens, you put transformation of the healthcare sector. And then Alexander, you also wanted us to take a closer look at an area that is maybe a little bit more forgotten, to look at the social protection elements and programs. And Dominic, from your horizon, it is to work for the equal paid parental leave. So if we should just use some minutes that we have in this conversation, I think it would be really, really interesting if we start focusing perhaps on number 5 then, that is the one that seemed to be the one that most of you felt was really important. Do we have some examples in this group of good practices in the work of changing gender norms and the conception of the gendered aspects of caregiving in connection to the unpaid care? I think that would be extremely interesting to hear.
У нас есть примеры лучшей практики изменения гендерных норм, главным образом в отношении неоплачиваемого домашнего труда? Хорошо было бы примеры конкретные.
Oh, all breakout rooms will close in 1 minute.
Все, нас выбрасывают из секции, поэтому...
Okay. But then that means that this was as far as we got. I would quote the open space approach, saying whatever was said in the room was the right thing to say. I thought it was lovely to see you all, and we will meet each other again in the big room in 30 seconds or so. So thank you so much.
Thank you. Nice to see you all.
Thank you.
I think we have many examples in the room
I think so too.
to answer the question.
Yeah.
Ведер считает, что примеров-то у нас много.
We have about 12 people in the room right now, so I think that we can actually be able to maybe introduce ourselves. If you all want to unmute and introduce yourself, it'd be lovely to be able to get to know all of you. As some of you may know, my name is Apta. I'm a senior program officer with Promundo and one of the co-coordinators for the MenCare campaign. Okay, can I ask you that you go next?
Sure. Hi, Apta. How are you?
Good.
Good. Good. Thank you for a terrific presentation. The report looks really interesting. I look forward to chatting about situations in North America. So I'm Craig Norberg Bohm. I'm a coordinator for the North American MenEngage Network, which covers practitioners and activities in North America, in US and Canada. So we have a membership activity going on.
Wonderful. Duncan, I see your camera's open. Would you like to introduce yourself?
Sure. My name is Duncan Coltharp. I am a student of public health in Maryland.
It's wonderful to meet you.
Good to meet you as well. The presentation was really good.
Thank you. Lakshman?
Hi, everyone. Good morning, good afternoon, good evening, where you are. My name is Lakshman. I work at the MenEngage Global Secretariat as one of the co-directors.
Wonderful. Thank you.
Tamara.
Sorry about that, having technical difficulties here today. Construction outside my window. I'm Tamara Magnan. I work for Community and Social Services for the government of Alberta. In Canada, for those who may not know.
Thank you.
Hi, everybody. Hi, my name is Samuel Enyon. I work for the Bissell Center in Edmonton, Canada. I am a family support worker.
Wonderful to meet you.
Good morning, everyone. I am Kevin Liverpool. I work with the Caribbean Male Action Network. There wasn't a Caribbean breakout room, so I think this is the closest one to our context and language. Thanks.
Yes, Kevin. We have representation from the North American MenEngage Alliance here, and I think we include the Caribbean in that region as well. So thank you for joining us today.
Namaste, everyone. I'm Meena Sharma from Nepal.
Wonderful to meet you, Meena.
Thank you.
I believe that we've all introduced ourselves. Did I forget anyone?
Yeah. Hi, my name is Mike Smith. I'm the Aboriginal Community Family Support Worker for Candora Society in Edmonton.
Very nice to meet you. So I'll get started. We wanted to use this opportunity to really think about kind of what are our opportunities to collectively think about how to push some of these agenda items around caregiving forward. So we've come up with a number of questions to be able to discuss together, but I think that because this is an open space, we can feel free to help direct it in the way that we think it's best suited. So I want to just open it up. Please, everyone, feel free to just unmute your mic and offer directly. Of the 7 action points, which one feels like the most feasible or the greatest momentum, or even the one that we need to push for the most, even if it's not feasible within the short term? And are there things from the models that were presented during the panel presentations that can be adopted in these efforts? The second question, which is related to this item, is for the action points that we don't think are really relevant or feasible in this time, in the short term, in our region, states, or even globally, why might they not be priorities?
If there's any chance you have a slide with them listed?
With them listed, I certainly do. Here you go. Can you see this all?
Conversation, so we can talk about them. Yeah, I can't remember them.
Absolutely.
Yeah. Sure.
So just a reminder of the 7 action points. We have national care systems and policies, expand social protections and programs, promote an ethic of male caregiving, paid equitable parental leave, transforming health systems, change workplace conditions, and hold male politicians accountable.
As for the United States, I think what was really notable was that map that showed how the US was like this massive wealthy country that didn't have paid parental leave guaranteed. And I think that the national care systems and policies, definitely with the new Biden administration, there's an opportunity to really put something in place there, for sure.
Yeah, absolutely. I think it's been an interesting conversation to have globally, where much of the world is moving forward around these issues, and the U.S., though it projects itself as a global leader, has been quite far behind other countries in terms of providing any form of parental leave, and parental leave that is kind of fully equitable and accessible to all.
I think it's interesting that we talk about the federal component, because I do believe that, the federal governments should take leadership. But for many of us, the United States is one, Canada is one, our provinces, our states have a lot of the actual policy responsibilities around these issues. And it really complicates it nationally, because different provinces, different states may have different needs. And I'm sure there are many countries around the world that face those same challenges. So I'm really interested to find out if there's any research or studies that show that federal governments who have taken the lead, that there is actually a difference in those countries.
So that's a question around versus private employers, or
Yeah,
kind of
or
private.
social, or it being socially led, which always scares me a little bit because I'm old. So, I hear cultural change, and my spidey senses go on red alert, because it can take a decade or more for actual cultural change to occur. And I mean, we saw the statistic, right? At the current rate, it's at about 92 years for that equalization to occur. So I'm just curious if there is, or if there's any anticipation of looking at if there's really a difference between that, if those federal governments take leadership, or if there are other areas like the social drive and the local, because the political part always scares me too, because it seems to be we develop quote unquote frameworks or strategies, or call it what you may, and then the next government comes in and well, that's their strategy, or that's their framework. It doesn't reflect our ideals. So we're going to start over, and we start the whole consultation process over again, when we all know that we're trying to make strides in the right direction, not to keep going back.
That's a great question. I don't know if anyone wanted to respond to that specifically. I can respond, but I want to open it up to everyone to be able to share.
I just want to mention, this is Craig, that many companies in the U.S. are leading in parental leave policies individually, and then some at the local level, I think there is a lot of examples. So a nuanced analysis would be helpful in terms of lifting those up. And I appreciate this comment about what is the complicating pieces and the value for federal policy. And there's such strong local work in particularly dad and father's engagement in the U.S., established programs, some interesting activities in our area, which is the Northeast U.S., of implementing fatherhood programs in child protective care processes. And I think that's very interesting place for it to be taking place. The whole promoting this ethic of male care, for example, and connecting to policy are interesting. We have examples of that could be lifted up.
Yeah. I think unless somebody has another kind of question or thought connected to Tamara's comment about kind of federal versus, or like kind of state centralized parental leave versus private, I can say that also to note that, as a fourth edition of Save the World's Fathers, there's obviously been 3 more that really outline the case for parental leave on the government level. And that's not to say that it's kind of an either or situation between the private employers and the federal government. But I think one of the things that we look towards in terms of why we sort of focus energies around the federal or kind of municipal state level of parental leave is the fact that that in focusing simply on private level employers, it creates an inequitable system of accessibility to a lot of these benefits. Those who are formally employed will then, depending upon the benefits offered by their employer, will have access to some of these benefits versus those who are not necessarily part of the formal sector. And as we know, in terms of larger economic trends, the majority of the world is kind of going towards more informal, either gig economy or kind of contract-based work. That is not something necessarily that as labor advocates we would promote, but it is kind of a growing trend to sort of really disintegrate the formal relationships between an employer and an employee. So in that sense, while there's benefits to being able to do that, what it really in the long term would create is kind of an inequitable system wherein some individuals have access to certain rights that others do not because of accessibility, opportunities, a number of different issues. I do hear your comment around kind of the back and forth and how things can become political. In terms of the benefits across the board, what we've seen is that paid parental leave, and we talk about paid, equitable, non-transferable parental leave, and so that's focused primarily on two partner households, wherein the leave is accessible both to the mothers and the fathers and not transferable. We say non-transferable because in the case of where leave is transferable, many times that leave is transferred to the mothers, and then you reinforce that inequitable binary between men not taking the leave and women taking the leave, and then kind of bearing the consequences of whatever of employer judgment, biases, prejudices. Paid equitable transferable parental leave on the federal level and on kind of the state level has had demonstrated impacts on the health and well-being of mothers themselves, fathers, and children. It also helps to kind of shift the norms a little bit. One of the greatest barriers to men taking parental leave is that fear of one, not having enough incentives to do so, so losing out financially or either in kind of their longer term prospects as a result of taking parental leave, and also kind of the stigmas around parental leave. I think we know we have ample evidence that women are that a part of the gender pay gap, not all of it, is motivated by the idea that women will go out of the workforce or be somewhat not fully involved in the workforce as a result of their as a result of being mothers, which is not necessarily the case, but that's kind of the prevalent idea that exists. And so many men kind of fear that consequence for themselves. But if we promote men taking on more parental leave, then you're starting to counteract that narrative a little bit and showcasing that both parents are involved in the care of their child. And then in terms of kind of longer term benefits, you've seen a lot of more gender equitable caregiving and parental leave in a lot of the Scandinavian countries and the Nordic countries, as well as in a number of other places. I highly encourage you to kind of look through the Save the World's Fathers reports from previous years, 2019 and 2017 to be specific, to kind of see what some of that evidence outlies. But we talk a lot about promoting those types of like national outcomes, health outcomes, public health outcomes for families and communities. And a lot of that, while it can be influenced by men taking on more caregiving through paid equitable parental leave. I don't know if anyone else has anything else to add or if that answers your question, Tamara.
Appa, there is
yes?
I see your message. Bianca wants to know when do we need to close the breakout rooms.
Can you tell her at 10:55?
55, okay. And then yeah, and I also wanted to add on actually on these 7 points. And I agree with what you responded to Tamara's question, and that's not only for the global north countries. We have seen that in South Asian context, and Meena ji would be able to speak for Nepal as well. we've seen that in Nepal during the phase of COVID on what privatization does, no? And then also within the context and framework, currently we are discussing within the universal healthcare framework, there is some evidences coming out from and state-run or where the care systems need to be located when it comes to the state policies and framework. That is something that will be interesting to look at and what the universal healthcare framework has been able to identify. Probably something to follow as well moving forward, but they don't really look into the kind of approach that we apply in the State of the World's Father report or the work we are doing on men and caregiving. It will be interesting to input. But another thing I realized with these 7 action points is the importance to look at these as packages, not as one versus the other, right? We have seen in South Asian context, we have ample policies in place, but hardly they are implemented at all. And hence there is, sort of in the write-up, in the documentation, you will have it, but then nothing works in reality, and hence not creating opportunities for the people who are at the margins of the margins to really be able to, take benefit from these policies that are in place. So I think, and also, I guess, one of the things that the feminist peace group always keep on bringing is also on how do we, divert the resources that usually go in the name of national protection systems into the care system. Protection meaning security and peace building processes, which are very highly gendered and very masculine, no? And then there are few researches that have found that the benefit of putting more resources on the national care system or the social protection system actually provides more safety and security for the general public. So I think to look at what does it mean for the private versus public systems in place, and we can also see in Sweden where the social protection system is run by the national government. That's not privatized or being given to others, and that has created a level of changes that are there. So something to look into those as well. Thank you.
Yeah, thank you, Lakshman. I think that that's a really good point, and it makes me think, Tamara, about kind of, I think maybe I'm misinterpreting, but I think I'm also hearing kind of the fear of a lack of buy-in or compromise on that level from those who would be directed to take on or manage these systems. And I think that's the one of the things or the key issues that we see is that we can create policies, we can create systems, but if there isn't a buy-in or a compromise or a feeling that this is an important investment to be able to take on, then it can lead to limited benefits or limited impacts. But I think that overwhelmingly they tend to err on the side of the positive. I think one example is that after when the pandemic hit and the CARES Act was passed in order to give kind of subsidies or benefits to individuals who had to individuals as a result of the COVID pandemic, what you saw is a prevention or a mitigation of deep poverty within the U.S. So the government was able to prevent against some of those efforts, which in the long run has a lot of benefits in terms of nutritional, mental health, and other impacts for younger children. But I think that requires kind of an investment in a believing that those systems exist. I think I hear Lakshman, and I agree that social protections programs and expanding those to include caregiving are incredibly important. But again, it goes back to that cultural belief or buy-in on the importance or the value of that. And so I think that promoting this idea of the value of care may be the central kind of need that's individuals, families, communities, the citizens believe that the value of caregiving is incredibly important and is a matter that is worth kind of providing high quality, accessible, and fully funded and fully resourced. And if it's not, then it's going to, even as you kind of build the foundations, if they're not sturdy, they're susceptible to either falling apart or lack of care. I'd love to hear from some others around what their thoughts are, if they see opportunities. I know we focused a little bit on parental leave, I think, because there has been a lot of conversation here. But there's also been conversation around childcare systems and childcare infrastructure and other areas. So I'd love to hear from some of those who may not have had a chance to speak, who can share some of their thoughts. I think if there's not really kind of a clear idea of what might be the most viable in the present moment, I think that one thing that we can maybe talk about together are thinking about also in line with some of the things that we already mentioned. What are the roadblocks and how we can overcome them, and what are spaces that can be identified for regional networking and gathering. I'm glad my colleague Craig is here, who is part of the North American MenEngage Alliance, wherein there is a lot of regional networking and gathering. But are there other opportunities or spaces that we can take advantage of at this time? I see that we'll be closing in about 35 seconds. So if there's any other last comments, I will please take the floor.
I'll just jump in and say that I would be welcome and interest in some ongoing roundtable conversation about these questions.
Absolutely, Craig. I think we can definitely organize that. And if the participants in this room would be interested in joining in on that, I think maybe Craig, I might elect that they reach out to you and via direct message on Zoom to be a part of those conversations.